Stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, Stacy's going to read out the roll call.
Councilwoman Melly Garthwaite is absent. Councilman Brian Locks.
Councilman Brian Locks, present.
Councilwoman Ann Heffernan.
Councilwoman Ann Heffernan, 1st District, present.
Councilwoman Michelle Coletti.
Michelle Coletti, 2nd District, present.
Councilwoman Sarah Akbarali.
Councilwoman Sarah Akbarali, 3rd District, present.
Councilman Gary Donovan.
Councilman Gary Donovan, 4th District, present.
Councilman Edward McMillan.
Councilman Edward McMillan, 5th District, present.
Councilwoman Dawn Callahan.
Councilwoman Dawn Callahan, 6th District, present.
Councilwoman Catherine Tucker.
Councilwoman Catherine Tucker, 7th District, present.
Councilman Christopher Vargo.
Councilman Christopher Vargo, 8th District, present.
Councilwoman Katie Muller.
Councilwoman Katie Muller, 9th District, present.
Councilman Stephen Johnstone.
Councilman Stephen Johnstone, 10th District, present.
And Chairman Nicholas Pascal.
Councilman Nick Pascal, at large, present.
Thank you, Stacy. First up tonight is our Health Department, Maureen Lillis.
Thank you. Good evening, Council.
Good evening.
For those who I haven't met, I'm Maureen Lillis. I'm the Director of Health for the city. I have been since 2010. It's a pleasure to meet all the new people I haven't met. I don't know if you want me to just do an overview
Absolutely.
of my salaries,
Great.
and then you can ask any questions. Okay.
Thank you.
So the two largest changes for this year are obviously a new position of Community Health Coordinator and a request for an increase in salaries, all health department salaries, to be paid using workforce development funding from the state of Connecticut. Now, the personnel detail does not reflect the salary increase because, and I think maybe David could explain it better, but it's funding that we're getting from the state. So I think the recommendation was just to put in our contractual increases. And then if the workforce development funding was approved, the increases were approved, then we would do that offline. But I'm proposing 3.5% per year per employee, and that will be paid using public health workforce development funds, which we are getting $208,000. $208,568.80. That's over 3 years. We're a year behind, so this actually wouldn't even be effective probably until the end of the year because they're slow with the contracts. I also put in some fringe to come from this grant to help offset some of that. And then the community health coordinator is something that is just almost vital to the health department. For years, we've functioned as merely an enforcement agency, and we're so much more than that. We're supposed to be doing advocacy and outreach. And fortunately, now we have a social worker, but we need this community health coordinator to help find our vulnerable populations and help me to develop programs for them. And that's this position is not new to public health. It's not new to health departments. It's new to us, but it's vital to me to be successful. So those are the two big changes. If you have questions on them, I will.
The social worker, is that a position in City Hall or outside of City Hall?
That's in the health department.
Health department, okay.
Yes.
Does anybody have questions for Maureen?
Councilwoman Tucker, hi.
It's nice to see you kind of shifting positions into having more input into the health of the overall health of the city. So it's nice to see that.
Thank
and I
you.
think that there are a tremendous amount of vulnerable populations in our city that could benefit from, the work that you're proposing be done going forward. Can you talk a little bit about some of the programs that you envision bringing forward with this new role?
Yeah, so right off the bat, we have to work on opioid education, and we've already started. We're going to be doing Narcan training. We've ordered Narcan, which is coming in this week. We're going to be doing training with our EMD, Rick Fontana. But our numbers are staggering. Our overdose numbers are staggering. And when you look at the age group, it's very surprising because it's not what I thought. It's people 30 to 35, 50 to 59. So we have to sit down and figure out why this is, and we have to do some education on these populations. We're talking like 140, 150 over a 2-year, 153. I was just talking to our board chair about that. Opioid education is huge. Harm reduction. Equity. There are a lot of people, homelessness. There's opioid is my first
Yeah.
project because it's immediate and we're way behind on it.
Yeah. We hear a lot of discussion about, mental health and the impact that the mental health crisis
Yes.
is having. Can you just
Sure.
talk a little bit about that?
Sure. So this is a good opportunity to tell you about May is Mental Health Awareness Month. We are going to, as a city, be observing this month with a couple of things. May 1st, Wednesday, May 1st, sometime in the afternoon, I believe 4 o'clock, we're going to be on the front steps. Hopefully the public, everyone's invited to come and listen to the mayor give an address. And we have 3 or 4 agencies that are going to come and talk about the services that are offered to residents, like Fairhaven Health Center, like Shoreline Wellness, like Bridges, and maybe even an agency too with Inside. They're going to talk 3 to 5 minutes to talk about mental health and talk about what they offer to our residents. Throughout the month, I'm going to take each population, vulnerable population, and conduct an activity. For example, on May 24th at Savin Rock School, there's going to be a nonprofit that comes in to offer a basketball clinic to our at-risk youth, and that's from 5 to 8. And part of the program is not just playing basketball. After an hour and a half, it's taking them aside to have conversations with them in a safe environment, see if there's anything they want to discuss. And we're going to have 2 SROs present from the high school. The hopefully connect or foster a better relationship between the two. And we're also going to include an event for veterans.
What was the date?
May 24th will be the basketball clinic. May 1st, so far at 4 o'clock, there will be a release coming out by Mike Walsh. So far 4 o'clock, but May 1st there is an event, a kickoff.
Yep. Very good. I'm really glad to hear that. I know historically we've done the Heart Walk with Yale New Haven Hospital.
Yes.
Partnership with them. And I know this year, unfortunately, they're in New Haven. No offense to New Haven, but they're not here in our city. Have you thought about, ways in which you can partner with the American Heart Association and, organizations like that to bring those resources to the city?
Yes.
They want a relationship with us.
Yes, and a perfect way to do that, we have a wonderful nurse, Stacy Walsh, who has been conducting blood pressure screenings throughout the city.
Yeah.
And also working at Yale, we hope to foster some sort of collaboration with them.
Yeah.
So that maybe we can do more. Hypertension is very high in West Haven.
Right. I mean, we've got a lot of statistics that show our areas of opportunity, and there's a lot of opportunity in West Haven, and I know that there's a need for resources, to come into the city, and I'm looking forward to what you're doing because there's a hunger for partnership.
And the community health coordinator is just the person who will help to identify these populations and these pockets of the city there are places I know that exist that we have not gone into. And a lot of what we're going to do in May is we're not going to wait for people to come to us because we spend a lot of time planning events and people don't show up. We're going to go out to them. Like, for example, we're going to go to the church on the green and maybe show up at some of the dinners. And that's just how we're going to do it, so we don't miss anybody. We're trying to grab as many people as we can.
So the last question I have for now is, I don't really see any programmatic asks in your budget. There's nothing that kind of reflects resources that you may need to do the work that you're kind of proposing be done, because it looks like you're going to use only the people that are doing that work. Are there other things that you may need to kind of bring forward any of these programs that you're speaking about?
Well, the position is huge. One of the things that is going to be helpful that is coming down the pike, I think, soon is this Mitchell Humphrey software, where we could enter a lot of our data, our inspections and our data.
Is that something that the
city's working on as a whole? Yes.
Okay.
I think all the departments, relevant departments, will be able to tap into it. We'll need to customize ours a little more because we do a lot of different work, but yeah, I'm definitely in on it.
Okay. That's it for now.
Thank you.
Thank you. Councilwoman Heffernan. Welcome.
Hi.
Hi.
I just have a question about the community health coordinator
Sure.
position. Do you have any idea of what type of person? Is it going to be a nurse, an LP, an RN, an LPN?
It would be a person with at least a master's degree in public health,
Okay.
or about to get a degree within a year. We have a nurse, we have a social worker.
I know. I was just wondering what type. It says, I
Yeah.
figured what kind of person are you going to put in this
Sure.
this role? What degrees?
Yes.
So, master in public health. Okay. Thank you.
Thank you.
Are you looking forward to hiring another sanitarian?
I think at this point, so we cannot find a registered sanitarian. We're having a hard time. We're getting no resumes at all. I know it's the salary. The problem is also the field. The sanitarian pool is very low in the state. During the pandemic, people retired, and a lot of people did not join the workforce, which is why they brought this workforce development money, because I know for a fact, as we speak, people are trying to recruit some of my sanitarians.
Mm-hmm.
And so by offering them this increase, it gives them a little extra reason to stay with us.
Okay.
I think, quite honestly, we're good.
That was my second question.
I think there's always room for more, but if I had to choose between another sanitarian, they're getting by, they're doing well,
Okay.
and a coordinator, I need the coordinator.
Absolutely.
And I want to start expanding on this part of our department that's so vital.
Right. Thank you so much, Maureen.
Thank you.
Councilman Vargo.
Thank you, Madam Chair. Hi, Maureen.
Hi.
I have a couple questions about the sanitarian positions.
Sure.
Can you tell me what the difference between a registered sanitarian 1 and a sanitarian 1 is?
Registered sanitarian has it's like a licensure. It is a licensure. So they have to pass an exam at the state, and they have a license. Sanitarian 1 does not have the license. Now, they can still perform all the same duties, but the registered sanitarian has a little more.
Is that the person that signs off on?
They sign off, they write orders. Exactly.
Okay. And is this correct that the registered sanitarian position's been posted for 5 years?
Probably.
Okay. And that's the position that we're having a hard time filling?
We are.
And
But I'm hoping that as our junior sanitarians get more experience, they take the exam. Because I love to foster that professional development, and hopefully one of them moves into that position at some point.
if we don't have a registered sanitarian at the moment, who is...
We do have Hillary.
Oh, we do?
Yeah, she's an RS. She's the chief sanitarian. We have to have one, and each health department is required to have one RS.
Okay. So she's kind of filling dual roles until you can...
Well, she's
registered.
She just has, yeah, she's
She has
the
the
RS that we put on our per capita application. We're required to put our RS
Okay.
just to let them know we have one.
And I see that the social worker position was added to the budget for this current budget that we're in now. Is that being posted?
That's what we have someone already
do have someone.
who started about a month ago,
Gotcha. Okay.
3-4 weeks ago, yes. And she's part-time at the library. She's, seeing clients already.
Okay.
And we're trying to reach out more and advertise that she's here.
That's all I have. Thank you.
You're very welcome. Anyone else have any questions? Councilman Donovan.
Thank you, Madam Chair. Hi, Maureen. How are you?
Hi.
The community health coordinator sounds like it's a great benefit for not only the residents but for your department. The only question I have is the amount. How did we come up with that? The amount for the community health coordinator.
So that position would be her level would be, or his level would be equivalent to Hillary, who is a supervisor. This person would be in a supervisory position because at some point down the road, maybe a year or two, if we have one more health educator or outreach people, that person would supervise. And so that is contractual.
Yeah.
Like just kind of equivalent to Hillary's salary.
Okay. I just didn't know if that
Yeah.
was, if we looked around other towns and that's what
I
they
mean-
had and whatnot. So I was just.
I included, you'll see Stratford and Milford salaries, and those are comparisons in case, you wanted to know why I'm asking for the increase for our salaries. That's all that was for.
All right. Very good. Thank you.
Thank you.
Thank you, Madam
You're
Chair.
welcome. Councilman Johnstone.
Thank you, Madam Chair. Quick question, going back to the beginning. The raises, funding through the grant, my question is, it's a two-part. One, does the grant ever run out? Or is it a continuous grant?
3 years. 3-year grant.
And then after that, we're on our own to maintain
Yes.
that? Okay.
But, we get other funding. We get per capita funding. And, we're not asking for a whole lot. When you look at our salaries, even with the increase compared to other towns, it's quite significant.
Okay. That's all I have. Thank you, Madam Chair.
You're welcome. Councilwoman Tucker.
Are there any partnerships with any other health departments like New Haven or Milford that you engage in?
We belong to a region, Milford, Orange, New Haven, and believe it or not, Wallingford, Quinnipiac Valley, and believe it or not, it goes up to Essex, towns in Essex. We work in a region, but we work as a region in public health emergency preparedness.
Okay.
That's how we work together. We definitely run ideas off each other. Sometimes on a Friday or Saturday night when you want to talk and try to share ideas because we're neighbors. Milford, New Haven, Orange, we're neighbors.
Yeah, because they have a lot of programs too, and I was wondering if there's any possibility to work collaboratively because our communities kind of are similar.
Similar. New Haven, we can definitely, and I have a pretty good rapport with New Haven's the clinical department.
And the last question I have is about the community health needs assessment and whether or not you participate in the community health needs assessment or anyone from your department.
Community health coordinator. That will be a huge task.
Okay, so
we need to be doing our own. There's the Data Haven that comes out, and we certainly contribute. We give them our data. But I would like our own health improvement plan.
Right. So, and is that, so the health improvement plan is created after the assessment is done?
Right.
Correct?
Correct.
And are you saying that you would want to do your own community health needs assessment and not the one that the hospital conducts for the
do the
state?
hospital, yeah, we always participate. But it would be nice to, because I think that the one the hospital does is good, it's accurate. I don't think it's as detailed as I'd like to see for our own town, our own city.
Okay.
It's good, and I use it.
Yeah. Thank you.
Sure. Thank you.
Any other questions for Maureen? Councilwoman Callahan.
Thank you. Good evening. How are
Hi,
you?
Good. How are you?
I have a general question. How many employees are in this department?
Yeah, we're up to almost 9 now.
Okay, so it is just 9. Okay.
Yeah.
And then how many are outstanding or out that you're looking for right now?
Well, right now we're just if we get approved for a health coordinator, that's about it.
Okay.
Yeah,
Thank
for
you.
this year.
Thank you.
Thank you. I mean, I could ask for positions every day, but as we grow,
Councilman Pascal.
Thank you, Chairman. Hi, Maureen. How are you?
good.
General curiosity.
Sure.
One of the requirements on the health coordinator is Spanish communicator. Do you currently have any Spanish communicators in your department?
We have 3.
You have 3. Okay.
Yes.
All right. I was just curious if it was like
Yeah. It helps quite a
big
bit.
need. That's why it was put in there. Thank you.
I will be looking heavily at that. We have Spanish, French, Hindi, Nepali. Yep, French. Yeah, we have about 5 languages spoken now in our department. Getting there.
Councilwoman Coletti.
Thank you, Madam Chair.
You're welcome.
Quick question
Sure.
from a newcomer.
Okay.
I'm going to leave most of this to our very well qualified nurses, et cetera, up here. Can you describe just very briefly and generally what a sanitarian does?
Sure. A sanitarian is a fancy name for, well, they're inspectors.
Okay.
And they go out and inspect food establishments, restaurants, supermarkets, delis, anyone who sells food. They also inspect, in West Haven, we inspect and enforce hair and nail salons, tattoo parlors. We do green pool water, environmental health complaints, a lot of complaints, infestations, mold. They do a lot. Beach water, sampling in the summertime to make sure that the water is fairly safe to swim in. They're inspectors, but so much more. We have a wonderful group of sanitarians at the moment.
Okay, great.
Very dedicated group.
That's it for me. Thank you.
You're welcome. Any other questions for Maureen? Seeing that there aren't any, thank you so much, Maureen, for
Thank
your
you.
presentation and for answering our questions.
Thanks for inviting me.
You're
Thank
very
you.
welcome. Just gonna wait a couple minutes before we start the next one. Okay, we are back in session. Next is Chief Terenzio with the Allingtown Fire Department.
Good evening, everyone.
Good evening.
Chairman Pascal, Committee Chair Akbarali, members of the City Council. Thank you for the opportunity this evening to present my department's budget for your review and request for approval. Financial roadmap before you this evening, although an operating budget for this fiscal year, essentially is a result of more than 3 years of planning. Through the development of a 5-year strategic plan, which began 3 years ago, I am excited to present this budget as it contains and provides funding for major goals in this plan that have not yet been achieved. The City of West Haven Fire Department in Allingtown protects 3.2 square miles in the northern tier of the city, with a year-round population of approximately 16,300 residents and a seasonal increase of approximately 7,700 when UNH is in session. Our call volume this past year was 1,973 calls, which is only in 1/3 of the city. With that represents 28%, or 553 calls for fire-related emergencies, 72% at 1,420 calls for EMS at the ALS and BLS levels, and 67 mutual aid responses with our colleagues in the Center and the West Shore districts, accounting for about 3% of the above number. We also do community outreach and risk reduction efforts, which include a smoke detector distribution to residents with a certain level of financial need, our highly successful certified child passenger safety seat inspection and installation program, public fire prevention and education, CPR and first aid instruction, and we're also proud that we are a charter sponsor to the organization of the Boy Scouts of America for the all-girls Boy Scout Troop 821. Target hazard risk reduction also is part of our mission of non-compliant basement and attic apartments, which is currently in development stages. With the assistance and support from the finance director and the mayor, we have achieved with this year's budget an enviable fiscal condition of increasing service levels with a lower funding request and a slight reduction in the mill rate for our constituents from that of last year. To highlight this overall, it provides funding for 4 additional firefighters, EMT medics, that brings us closer to the compliance with the National Fire Protection Agency and standards of OSHA mandates. A full-time fire marshal as well, increasing our fire prevention efforts, and increases our approach to overcome our recruitment and retention challenges. So in summation, this request enables the department to increase service levels by almost 30% with a 2% lower request over last year, resulting in a 2.5 mill rate decrease for those in Allingtown. It is my sincere hope that you will recognize this budget provides for a financial blueprint in continuing to provide and increase effective fire and life safety protection services to our citizens. So I thank you, as I am prepared to answer any of your questions you may have, as I also have with me Deputy Chief Fire and Fire Marshal Mike Esposito and 2 of our Fire Commission members, Chairman Iris Diaz and alternate member Frederick Brown.
Thank you so much, Chief Terenzio. So for the fire marshal, what is the ask in salary?
I just did notice, and I conversed with Dave Taylor, that it wasn't in there, but the ask is $89,000.
Okay.
Yeah, but it's funded. It's if you look lower down in the. Let me get to that section if you don't mind. Yeah, just below firefighter, it says mechanical support. Well, we changed that.
Can you come to the podium, please? Thank you.
Yeah, no problem.
We had budgeted an extra firefighter in this number, and that salary is effectively just moved up to the deputy fire marshal line.
Okay.
And that it says fire marshal, but it's really deputy fire.
Okay.
Full time.
Thank you for clearing that up.
Thank you, Dave.
And also for your training and education, who will be conducting the training?
Right now, our on-duty captains, as active shift commanders, also are responsible for disseminating the training to their staff that are assigned to them under the direction and coordination of our deputy chief.
Okay. And this will be separate hours, not while on duty?
No, that's conducted on duty.
On duty. Okay. Does anyone have any questions for Chief Terenzio? Councilman Vargo?
Thank you, Madam Chair. Thank you, Chief, for being here, and your Deputy Chief as well. I have a couple of questions, and I'll try to go in order. Going back to the salary, because I just want to make sure that we have the numbers correct. You're asking for the Deputy Fire Marshal, not a Fire Marshal, right?
Correct. That's still been going back and forth. There were some discrepancies. This needs to be ultimately decided by our Board of Fire Commissioners, because they set that hiring and firing policy. It's all up to them. Right now, the major part of that is conducted by our Deputy Fire Chief, who's doing two pivotal roles. Deputy Fire Chief needs to be as equally up to par as to what I'm doing, but also it's also a very important position as the Fire Marshal. He's doing both roles, and so essentially we have half a person doing each. So it is our intention, we need to discuss it because this position will belong to the union.
Is $89,000, regardless if it's a Deputy Fire Marshal or Fire Marshal, is $89,000 enough money, regardless of the designation?
It's a fair starting point.
Okay. And I understand that, we're taking that from the firefighter line item, so instead of 2 additional firefighters, it'll be 1 additional firefighter?
1 additional from over last year, which we were building up in anticipation of getting a SAFER grant, which I began immediately applying for, but over the past 3 years, we kept on trying to improve it. But fortunately, one of our colleague departments, the Center Fire District, also put in for one this past year and received it. But in the times prior to that, I had been building up to get to that staffing level.
Okay. So the reason I'm asking is because during your initial presentation, you said 4 additional firefighters. Is that from the 2024 numbers?
That's from the 2022 numbers. Essentially, why I say 4 additional, because right now we only have 20.
Okay.
Let me further explain that,
yes,
Councilman.
Because part of what I want to make sure is that when we're deliberating and we can make these adjustments to make sure your budget's accurate, I want to make sure that we include the correct salary, the correct staffing numbers.
Okay, understood. What we have right now, our current staffing level is 4 captains and 16 firefighters that are either paramedics or EMTs. We've been trying to build up our staff to an additional 4 individuals so we can have 6 on duty as opposed to the 5 we have now to meet NFPA standards and OSHA mandates. I've been slowly trying to build the budget up to that point. If this budget's approved by this board, I will be able to hire 4 firefighters additional to what I have right now.
So in the FY24 approved budget, you have budgeted 19 firefighters.
We have budgeted 20 firefighters.
20 firefighters, okay. Yeah.
Yeah, it's a little confusing because we've been building it. That versus my current staff.
Okay, can we shift the conversation to just what the budget is? I understand that you're hiring, but I want to make sure that we are budgeting enough positions. So in the FY24, it's budgeted as 19.
Correct.
Okay. And then the FY25 recommended budget is budgeting 21.
It's budgeting 20 firefighters.
20. So we're removing 1 firefighter.
That had retired.
So we're removing 1 firefighter from the correction that we need to make is we're removing 1 firefighter and then moving 89,000 from that line item to either the fire marshal or deputy fire marshal.
Correct.
Either way.
Correct.
And adding 1 to those. That's
correct.
the correction we have.
That's correct. That's correct.
Okay. I'm good there. Moving on. On your income line items, that's page 117. line items 47060, fire department transport income, and miscellaneous 47900 have been zeroed out. Could you explain what those line items are and why they were zeroed?
Because they're combined collectively. It's bundle billing and transport. We do not maintain the transport license. AMR maintains the transport license. So when we do transport, it's not all the time. We get a share of that through the commercial ambulance. We just did a quick analysis through the request of the finance department, and I got a readout from our separate billing agency that collects our EMS transport. We average about $30,000 to $40,000 between both EMS transport and paramedic. Not at all.
There's a little bit of accounting or budgeting technique going on here, and if you would look at the accounts the chief was mentioning, the 47050 and the 47060. If this were to be correctly characterized, there'd be 40. It would be split between the two lines. There would be more money on the 470. I would say 36,000 on the 47060, and 4,000 on the 47050. No change to the total budget, but that 40,000 just happens to be on the wrong line. You see what I mean?
Oh, okay.
Is everybody following that? Sorry to ask questions.
No, not at all.
Just want to make sure. And if you look at the miscellaneous category, which was the other item you were asking about, our budgets are zero always. That's a random thing that comes in. We have actual and we have projection.
So it's non-budgeted receipts.
It's not, yes.
Gotcha. Okay. Next questions are on page 118 of the budget. Throughout your materials, Chief, you had talked about not allocating as much funds to capital improvements for the firehouse pending a study. Do you have any sense on where we are in that study, when it might happen, or is that a loaded question?
Well, I wouldn't consider it necessarily a loaded question, but a question that everyone's been trying to get an answer to, only because under the auspices, well, not the auspices, but the ARPA money that we received, the MARB has requested that a study be conducted. We have been trying to identify property, and we actually had plans developed. We've actually spoken with and want to go into collaboration with the Allingtown Library in doing a joint facility. But it's all been placed on hold because it's kind of like beating a dead horse. The amounts of money that will be needed for us to develop a new facility, we can't come to this body right now without other funding sources, federal government, state government, other lending opportunities to actually even do any kind of meaningful plan to do that. So it's kind of like just been put on hold.
So if I read the budget correctly, the building maintenance and repair line item is being reduced by a fairly significant sum. Given the fact that the age and condition of the building, I just want to make sure you and your staff are comfortable that the amount that's being budgeted is going to cover what your averages are.
And I appreciate that, Councilman. It's, in trying to provide the best and most effective service that we can without overburdening the taxpayer, we really, and through the finance department's direction, we really looked at and annualized what we've been spending over the past 3 years. Maybe we've been asking too much. What we tried to do is really pare it down and really make an assessment. Do we need this amount of money? It's easy to say, I need this amount of money because I'm working out of a 1928 vintage fire station. Well, that 1928 vintage fire station at one time was very, very active, very important. It still is to a degree, but it's not as active as it used to be. The other station that we're operating out of, which is where our on-duty staff operates out of, which is on Fairfax Street, is overcrowded. And over a year ago, when we received the ARPA funding and went to the MARC to request for infrastructure facility improvements, they came out, they inspected, they looked at all three departments, and they said, yes, we see your need. Thank you. You're trying to do it. So I took that money that we had allocated, and we're going to improve there for this year with that funding, in hopes that that will sustain us until we can get to a point where we can actually talk about a new facility.
Okay, thank you. Regarding the telephone expense, a number of other departments have come before us, and their increase has been more substantial than this because of different contracts or different services that are being purchased. I want to make sure that nothing's changed with your department.
I'll give you a little quick funny story. When I first got here, the phone set on my desk still had SNET on it. So I think that'll give you an indication of how old the phone system was. With last year's money, we improved that whole system. And we've had our administrative assistant call all our vendors that we have a monthly relationship with and ask for, is there going to be any increases? Let us know, all that. So this is what we came up with. We have an updated phone system already. And that telephone expense does include our cell phones. So we will be adding one more if we are successful in getting a full-time fire prevention, and that's what I'm going to refer to him as, a full-time fire prevention officer, to take a lot of the burden off my overworked deputy chief. So we should be good.
And this is why you had asked the council to approve 2 weeks ago the unallocated contingency transfer into the telephone system.
What happened with that, and I apologize if I had thought I was supposed to be here that evening, I would have been, and would have been happy to answer those questions. What had happened there, the unallocated contingency had to be hit, which we don't do on a regular basis. It's our shock absorber. It's something that, to cover something that we're not expected. We had a couple of things that had happened. We had a very expensive piece of equipment got accidentally destroyed, and we had to replace it pretty quickly. That was at the tune of about $9,500, which was covered by insurance. But by the time the insurance process went through, we had to take it out of our equipment maintenance budget. The other unforeseen problem happened with our 25-year-old 1999 reserve pumper. We had to go out for went out for its annual inspection. A number of items had to be addressed on it. We need to have a reserve pumper. That was another unallocated hit that we had to do. So what had happened, we needed to move some money back into those accounts because Munis wouldn't let us pay for it.
And so you're comfortable with the equipment maintenance budget that you have asked for and the mayor's?
We're comfortable at this time, and in conversations with the deputy chief and our superintendent of mechanics, we have a new pumper that was obtained through a FEMA grant. Our aerial has been all updated. We're redoing a rescue truck. We're doing it with a refurb with a new cabin chassis. And our rolling stock is getting to a pretty reliable stage.
Is the refurb for the you designated as E8 for bonding for FY?
Well, that's Engine 8, and that's operated by the AF of the Allingtown Volunteer Fire Association, which we really have no interaction with that way.
So the cab refurb is a different.
The cab refurb is for the EMS transport rescue vehicle that all three districts operate our paramedics on.
And you have the funds for that?
Yes. This year we do.
Okay. And my final set of questions is regarding the pension line item, 54140. It went down a very significant amount. Could you confirm why?
That's because we're losing people that are on the pension more so, and more people are on the Maybe you can help me with that, because That was a little more dictated by finance.
Are you looking at the change from 2,540,000 to 2,459,000?
No, I'm looking at line item 54140, change from 166 to 92. It's the Penson City share.
So you have to look at that, and you have to look at the other page, the page that is total administration.
Okay.
And if you look for the same account number 54140, you'll see there's quite a bit of money there, $2.5 million, 2.7 in the current budget. So the pension is calculated based on actuarially defined contribution. We get those from our actuary, and the numbers here, I can't remember how much added to, but the Allingtown Fire Department pension is very underfunded. So I get the ADEC, which is what we call that, and I add a few $100,000 to it for every year. And so that number is actually what we're required to fund to bring the pension whole in 15 years is less than this number. We're trying to get it faster done. So it's in total, we're really up, is what I'm trying to point out.
So what's the interplay between the because one is under the administrative budget and one's under the operations budget?
Two different groups of people.
Okay. So two different groups of employees?
Correct.
Okay.
The operations, that's the
People that are active,
vector.
and the other one's on the people who've retired.
Except for it doesn't make it doesn't make sense, but
I
yeah,
guess
but that's just where it goes. Yeah.
Bottom line, I saw that it's a large reduction in one of them. I wanted to make sure that was okay.
It is.
And
It
if
is.
you're comfortable with it, I'm happy with it. That's
Absolutely.
great. I'm all set. Thank you all.
Yeah, thank you.
Chief Terenzio, item 56990, miscellaneous. Can you explain to me what that is?
56990, that's what we identify. That's the line that we use to pay for hydrants that are struck throughout the year that we need to have replaced to pay the Regional Water Authority. Cost of a hydrant is now about $9,000 to replace totally. I'll give you an example. The year before last, we had 3 of them struck. So that's $27,000. So we quickly wipe that out. But we do get reimbursed for insurance for that. And we get the insurance check, and I've been working with finance to try to get that money back into the line item so we can reallocate it again once it comes out of the miscellaneous. I don't have a hydrant account,
Right.
but it's for miscellaneous things such as that.
Okay. Thank you. Any other questions? Councilwoman Callahan, I'm sorry.
Thank you, Chairwoman. Good evening, Chief. How are
Good
you?
evening. I'm well. How are you?
First, I'd like to say thank you to you and the whole Allingtown Fire Department, first responders, for a job well done with the fire recently.
Thank you.
And I know you all work very hard. I've personally been in the building a couple times, and I know you have your challenges as well. So I think that's why Councilman Vargo is so thorough with asking to be
I
sure
appreciate that too.
that we want to be sure that everybody's okay with, the budget. You've done a fantastic job.
Thank you.
With, even the meetings I've been to. That being said, though, I was curious about the line item 52820 with the psychological testing. Could you explain that?
Yes, I can. It's really misnomered. I don't know why it's in there as that. I've requested that it be changed to it's our annual physicals that are required by OSHA for our firefighters.
Oh, okay.
That's what it's for. And I apologize for that. I've been trying to get it changed, but it's not. We're not all. What's the proper term? I mean, it's just so we can be sure that we're physically fit to do our job.
Understandably. That was all. That was my only question. It was
Great.
more of a comment of a thank you, and we appreciate everything that you all do. And yes, we want you physically fit.
Thank
you.
you.
Thank you.
You're very
Chairwoman.
welcome. Councilwoman Heffernan.
Hi, Chief. Thank you for coming tonight.
Thank you.
I have a couple of questions.
Yes.
First of all, where are your inspectors?
We don't have any.
I thought you were getting them.
We will. I had submitted a community development grant that I've been told I've received, but have not received anything official. Right now, I have two of our current firefighters are attending the inspector module just to do inspections, not the full-blown fire marshal. And we're starting to pay for that out of this current year budget. And I'm kind of putting the cart before the horse, but we'll be getting community development funds to develop our code enforcement specialist program. They'll be our inspectors, and they will work directly under the full-time marshal that I'm hopefully will be able to put into place, all under the auspices of Deputy Chief Esposito.
I'm certain you're looking forward to it. You're looking to add a manpower, one person per shift.
One person per shift to bring us up to a total level of 6, because in our district, like the other two districts, we're well over 4,000 people per square mile. And the NFPA says they refer to that as a dense demand zone, to quote the standard 1710, that requires a minimum when you're doing both fire and EMS responses. They say you should have 6 staff on duty.
I mean, I'm looking at this. I'm like, oh my God, you have three apparatus.
Yep.
And you have 5 people.
Yep.
In my head, I'm looking at your SOPs.
Yep.
I'm like, who goes on? I mean, you got 2 on the aerial, 2 on the engine, 1 in the rescue. I mean.
Well, we have to have 2 on the rescue.
Yeah.
And we have 2 on the aerial and 1 on the pump. And they kind of respond in joint. But we're able to do what we do because we know that we have the cavalry of the other 2 districts coming behind us.
Right. No, I understand that, but that's a tough.
We
that's
do. We do. I have to say, and I'm sure any chief in this city or around will always hail the efforts of their staff. And when I first arrived here just over 3 years ago, it was one of my first things I said I must accomplish is getting at least 1 more person per shift. I told that to my fire commission. And I've so often heard from colleagues throughout the city, don't know how you guys do it. Don't know how you do it with 5.
Right.
It's just dedication and training and
good teamwork.
And teamwork. And we need to do it because I have one gentleman that did suffer a long-term disability through a torn rotator cuff because he was doing more than he should have by himself. So it's in the long run, we're going to save money.
And where's you have an Explorer troop?
We have a Boy Scout troop of all females. And when they first approached me about it, I gave it some thought. And I said, you know what? One of my plans is to increase my inclusion and diversity. What better way than to expose firefighting, if you will, as a sponsor organization to females than the Boy Scout troop?
Yeah. Nice.
Because they're going to be doing things that may not be typically experienced by females. So we opted to do it.
Thank you for your time and
thank you
for all you do.
Thank you.
Councilwoman Tucker, you're very welcome.
Chief, thank you.
Thank you.
I really do want to just thank you as the chief and your deputy chief Esposito, for all the work that you're doing. We recognize your fiscal responsibility and the commitment, to making sure that you run a tight ship in Allingtown, and we recognize that.
Thank you.
And really appreciate the drop in the mill rate as a result of all the work that you're doing. So I just don't want that to, go unrecognized, and we really appreciate you.
I appreciate you saying so. Thank you.
Yeah. That's all.
Councilman Locks.
Thank you, Madam Chair. This is a rookie question. What drives the water expense?
What drives the water expense?
Yeah.
I'm trying to call back some of my training. The maintenance of the distribution system.
Okay.
Is primarily what it is.
Okay.
Hydrants, as I just explained, They're about $9,000. Someone to put one in.
Yep.
They're important, obviously.
Yep.
It also to have 100% hydrogen area does help in our ISO ratings, which is the next thing that I want to try to tackle. Currently, we're at a level 3. The highest or the best is 1. And ISO, for everyone that needs to know, it's the insurance services organization that sets the insurance coverage rates for the municipality.
Okay.
So obviously the lower the number,
Yep.
closer to 1, the less insurance you pay for underwriting.
Okay.
And we're at a 3, which is not bad.
I know that Aquarian was looking for a rate increase, and I think it got squashed. Is there anything on the horizon from the Regional Water Authority?
I have not
I
heard.
was just curious.
Yeah, we asked them for their rate. You're right, Chief. And they're very non-committal. I mean, it's all regulated, right? So we're not sure.
Okay. Account code 52360, business expense. What is that?
The business expense comes out of paying for the copiers, the office supplies, financial services is something else. It's anything that we need to do, postage, because we have to send our retiree checks out.
Gotcha.
That kind of thing.
Okay. And then account code 52420, financial services. That's the one you just meant. That obviously,
Right.
Obviously, it's going down 25%. That's great.
Yeah.
What is that?
Well, our financial services is our investment manager that we meet with once every quarter to advise us of the investments on the pensions and other investments that we have for the retirees.
Okay. Psychological testing somebody took care of. Heart and hypertension. 54180.
Knock on wood, we don't have any claims right now.
Okay.
That's another one that.
Yep. Yeah, right. Okay. And then personal computers, 14%, 14.1%.
That's for anticipating, hopefully, getting an additional staff. He's going to need a computer,
Okay.
or he or she.
Thanks for that. That's all I have. Thanks for your time.
Thank you.
Yeah, thank you.
Councilman Fargo.
Chief, I'm sorry if I'm just missing something, but I'm just speaking for me personally. It's important that I understand what you need for staffing, and I get this right in my head.
Absolutely.
What you're saying, what I've counted on your backup sheet is you have 4 captains, and those positions are filled. We're set there, right?
Correct.
Okay. I see that there are 20 total firefighter positions, 16 of which are filled, 4 are presently vacant.
Correct.
Okay. Then I think when you were speaking with Councilwoman Heffernan, you said 4 shifts at how many firefighters?
Right now we have 5 on duty. We want to bump that up to 6.
Okay, that's 24.
That will be a total of 24 staff for fire response. That includes the captains.
That's what I'm
That
missing.
includes the captains.
That's what I'm missing. Okay.
We need to have supervision. That's OSHA. We
Okay.
need to be sure that they're doing what they are intending to do.
I was taking it as 24 firefighters, and the math just wasn't working for me, and that's what I was missing.
Right.
So the 20 firefighters, let's assume that you hired those. We removed the 1 firefighter from this budget because it's budget for 21. We add that to the
Fire marshal.
the fire marshal or deputy fire marshal.
Correct.
You're comfortable that 89 at either way is fine.
Right.
And then you're good to go.
And just so you understand, so this board understands that really the significant need to do this. As I pointed out to you, 72% of the time we're out doing EMS calls, and we do a great job of it. That takes 2 of my 5 staff, 72% of the time, doing something else. That leaves 3 staff, captain and 2 firefighters, to respond to a call and do a entry into a IDLH atmosphere, immediately dangerous to life and health. And you know what OSHA says about that? OSHA says you shall only allow 2 people into that IDLH atmosphere and have 2 people standing outside ready to go in and get them. I can't do that. And there was a case out in Washington where they responded with 3 personnel. They went into the building with 3 personnel, effected a rescue. The victim survived. Someone filed a charge with them, against them in OSHA, and they lost because they didn't have 2 in, 2 out. I don't have that.
Okay. And if we take the 89, you're comfortable. I know I'm belaboring this point, but I want to make sure that 89 is an okay number for you.
It's a good starting number. And again, I would have to defer to my fire commission to make that determination as to what they want to make a starting salary for a fire prevention officer.
Okay,
full-time.
but you have some money in contingency to get us through this year.
If I have to. And again, for your edification, that position does belong to the bargaining unit. So it would be easy enough for me to go and say, yes, this is what we're going to do. I need to negotiate it.
Okay. You've cleared it up for me. Thank you very much.
Okay.
Councilwoman Callahan.
Thank you, Chairwoman. Hello, Chief. Again, quick question on 54032 lap premium. What is that?
LAP 540.
In the middle.
In the middle.
65.
Oh, it's insurance. That's
Okay.
That's the long term, and that's the long term. No. Oh, I'm sorry. I'm getting confused because we also have LTD for our firefighters that do not have a pension. That's our liability insurance that we've used a number of times now.
Okay, thank you for that. And also, on a good note, congrats to the department with our female fire person that just came on board.
First one for us.
And
First
she was
career.
part of that first call, and I heard amazing things. So
Yeah, she did a great job.
Thank
That
you
just
again.
goes to the testament of the State Fire Academy training program and our continued training and development.
Mm-hmm. Is going back to Councilman Vargo's questions about the salaries. Is there anything hindering us with having other people apply or other towns competing? Are they leaving?
There was. Thank you for asking that, and this budget addresses that. Just looking at the 3 districts in the city, Allingtown was the lowest paid and had the lowest stipends. We actually lost personnel to two of the other districts because they pay a little bit more and they have a pension. In fact, since I've been here, and it's almost on a much, much smaller basis, it almost mirrors what the PD has been explaining that they're losing. They're a great department. I feel that we're a great department. We're losing good personnel to other cities that we've developed their personnel for them, and off they go because we don't have the benefits to maintain them.
Is that just salary, or is there other things?
It's stipends as well. This budget includes an increase in stipends to maintain the paramedic license. Paramedic has a great deal of recertification and scrutiny by medical control, which is Yale. And they have to document everything they do and administer to those patients. And they are reviewed by a doctor. And it's a lot of training. It's a lot of retraining. And to do it for the salary that they do, my hat's off to them because they do a great job. So as a fire chief, what do I do to maintain them? How do I get them in? And I'm losing them to my neighboring districts and cities because I don't pay enough. Or we don't pay enough. So this budget also includes, that's why I said, it includes a little bit of an increase to improve our retention and recruitment and retention. I just lost a paramedic after 7 years to Brantford. 2 years before that, I lost another paramedic to Brantford. Just before I arrived here, I lost a paramedic to the West Shore Fire District because they have a pension and they pay a little bit more. And paramedics are hard to find, just like Maureen was saying in the health department. It's like sanitarians. Paramedics, the same situation.
It's a challenge for sure.
Challenges.
So hopefully this is a starting point.
Hopefully it is, but that's the title of our job, firefighting, a challenge. Whether you're pushing the paper or you're pushing the hose, it's a challenge.
Well, it seems like that you have to almost be not just trained in the fire, but the medically just as evenly. So, all right. Well, thank you for clarifying that, and hopefully we can start to move forward with this.
I appreciate the support and whatever support and way you can give clear for me. Thank you.
Any other questions for Councilman Donovan?
Chief, how are you?
I'm good. How are you?
Good. First of all, I want to echo what everybody's been saying. Congratulations on
Thank you.
Your staff, your crew, for the limited amount of crew you have, but you're doing
Thank you.
a great job. I'm glad you mentioned about the stipend going up for the paramedics. I know a few paramedics, not just in West Haven, but Nelson and AMR, and it is a lot of work to do that, and I applaud them for doing that. You mentioned before you're expanding Fairfax facility. Is that correct?
Yes, we are.
Is that to accommodate the female firefighter, or are you already have that established?
I have that established. We actually just submitted a request to spend about $68,000 of ARPA allocation money to develop the dormitory to establish private, separate cubicles for the staff on duty. Right now, it's open ward, if you will,
right,
and it'll give them a little bit more. But what we're going to be doing right now, if you were to drive by our station there, there's a lot of equipment sitting outside,
right,
expensive equipment.
Yeah, I know.
And the other main thing that why we're doing it, we are the only district in the city that currently does not have personal protective equipment gear extractors to wash our gear. We have to go to either the shore or the center to use their equipment. That's an issue for me. It's an issue for everybody. It should be an issue for the people in Allingtown. Because it takes our limited staff to go down to another district and use their equipment, which leaves us vulnerable. It's also going to become more and more prevalent because recently the state enacted a legislation to for hazard or toxic hazard accumulation on the gear for carcinogens to reduce cancer. So that means every time we go to an IDLH atmosphere or where there's the products of combustion, it gets on our gear, we have to wash it. And that's going to increase the frequency. That means I'm going to have to always be leaving. Right now, we're so jam-packed, I don't have any room to put these extractors. So we determined that we need another building, at least a area where I can put ancillary equipment that sits outside right now to stop it from being deteriorated by the elements, and a place to move a lot of the storage that we have for firematics, so I can put these gear extractors in, so they no longer have to leave the district to go. We're the northernmost. I mean, there's nobody else going to cover us. You know, and I love the center district. They're great. They're a great resource to rely on. But they can go down. They have us in the north, and they have the shore in the west, and we all can run into the center. I have nobody running into my center.
I understand that. Thank you. Thank you again. Thank you, Madam Chair.
You're welcome. Any other questions? Councilman Coletti?
Thank you, Madam Chair. Possibly a silly question. The $24,000 for not psychological testing but physicals. I don't want to assume that there are specialized physicals that are required for firefighters. Otherwise, it would be covered by health insurance.
Correct. It's NFPA 1582 is the standard.
Okay. And there's quite a fluctuation in the workers' comp premium. Can you speak to that for a moment?
The fluctuation in the premium for the workers' comp, we've had 2 injuries related to over the past year. One could be, in my opinion, directly attributed to the shortage of manpower. It was a torn rotator cuff, and it was severe, but he's going to be returning hopefully in June. Correct, Chief? And another individual had actually slipped on a 4x4 bandage, wrapping. They're slippery. And he slipped and he fell into the side of the rescue truck. And again, almost tore, complete tear of the rotator cuff. So that was an increase. And we still have one individual who suffered a CVA, cardiovascular accident. And it was a medical problem, wasn't through workers' comp. He's not on workers' comp, but he is on limited long-term disability.
I didn't want to interrupt
Yeah,
you.
sure.
I just actually wanted to make sure that it was sufficient coverage because it actually went down by almost 50%. So I just wanted to make sure that there was sufficient coverage in that line item.
We're hoping that the increase in the staffing will be able to do that.
Okay.
And again, we developed this budget with a couple of goals in mind, and the direction from the new budget director said, why don't you do this, see where you're at, do this annualization, which is essentially what we were doing, but we did it a little more accurately. And this is what we came up with. And where we felt was not quite comfortable with, we bumped it up. But the physicals itself, to answer your first part of the question, we are doing that jointly with the other district. We're doing that with West Shore District to try to get some cost savings. And we're going to be doing them in June. And they're going to be about $875 a physical. And there's an additional $335 for optional cancer screening. Again, more legislation regarding cancer in firefighters. If you don't start checking for cancer every year, you go to make a claim. If you contract it and you want to claim it's job related, you need to have this component. So that's why that's.
Understood. Thank you for the explanation.
Sure.
Thank you, Madam Chair.
You're welcome. Councilwoman Tucker.
What happens when someone's injured? You're already on a shoestring when it comes to staffing. So
Very good question, Councilwoman. It gets difficult because we do not have enough. You hit it right on the head. Sometimes we have to order in if we don't have no one that wants to be able to come in and cover that shift. With the small amount of people that we have, and this is probably the case throughout the city, I won't speak for my colleague departments, but we are a very strict, we're a mini maxi. We need to have this amount of people on. We don't have any buffer. Where I spent my 36 years of my career down in Stanford, they funded for over 60 per shift, but let that drop down to 54 before we would have to hire back. We don't have that kind of situation. So if a person's out, a person's in. And if we can't get someone to cover someone, we have to order back in. And it's getting tough, especially with, at one point we were down 3 people. It was starting to become very taxing. And during COVID, it was pretty close to a nightmare.
So are there any groups, like how nurses are, there's like a staff relief agency that we can pull from. Mm-hmm. You guys, firefighters, there's no such thing.
No, and I've often thought about that, where, you see, I'm going to cross over a line. We have over 100 firefighters in the city.
Cross the line. I know where you're going with this.
I only have 20. There's 32 in the shore, and there's over 50 in the center. Mm-hmm. I can't go to them. Different employers. Yeah. It's that simple.
Yeah.
Same union. I would love to be able to develop some kind of process with that, but that would require some discussion with the union. And I mean, a firefighter 2, paramedic EMT is the same in Allingtown as they are in the center.
Right. So I guess that's
different pay grades. But I think it's something that's not insurmountable, short of coming to that unspoken word.
Right, I know, I understand, because you're playing by the rules, but I get it. So I just, in the name of safety, I'm just wondering if there's ever been, a consideration for maybe something separate, leaving the 3 that are there the way that they are, but creating a pool of people that can step in legally and according to
I understand there was some kind of that was able to happen at some time long before I got here. I would have to reach out to my deputy chief to historically, but it's not insurmountable. If that were the case, we would just have to come up with the difference in the salary, whatever it would be, and it would have to be addressed by the union. And I don't think it would be that difficult. It's just another opportunity for someone to help out and make some extra money. Because we all do cross-train. And I do have to say, when I first got here, knowing that there were 3 separate districts, first fire that I responded to, it was seamless. Everybody seemed like they all did the same thing. It was like one department. So it's not impossible. And I might bring that up with my colleague chiefs if they're not watching already.
All right, good luck.
All set?
All set. Thank you.
Councilman Heffernan.
Hi, Chief, again, sorry. You don't have utility? You don't have utility?
No, you have to be very careful with that. I once spoke to the Connecticut Fire Chiefs Association when I did a short stint up in Cromwell. You have to be careful of the Department of Labor standards. If you pay someone to the point where you have to give them a W-2, according to the Department of Labor for the state of Connecticut, if it looks like a duck and sounds like a duck, it's a duck. That's an employee. You have to be very careful. And if you can't pay them $10 an hour like they were used to. You have to give them minimum wage.
Right.
And if you pay them, the king of all the acronyms, the IRS, wants to know about it.
No, I mean, I
Yeah.
understand that, but
We do, and that's a very good question. When we have the opportunity, we do have bunky people
right,
from UNH.
that will ride in.
Yeah, they'll if they have the qualifications and certifications, they'll ride along. But I cannot use them
As inside.
to fill in a union position.
Right. And manpower for you is devastating.
Correct.
Because I know that we had utility guys
Yeah.
at Engine 5.
Yeah, and it does work. I mean, I developed a manpower model in Cromwell to overcome that situation, and actually got a safer grant up there. And it worked. We had 3 full-time on a shift and 3 part-time, but they had to be part-time. You can't be a volunteer and not be part-time.
No, they were paid.
They were paid, so they were part-time.
But they would only do like nights
Right,
and weekends.
right.
Because that was like the
It is something that could be looked into a lot further. I've had some experience in that, but we do have the monkey program, but I can't use them to fill in a union position.
Understandable. I know the utility guys were actually supposed to be supplemental, not fill in.
Right,
But
right. And the bunkies do show up, the volunteers do show up when we have a major incident. They'll man the engine, they'll staff it, and we know that they're there, and they'll respond and report and be a part of the team.
do they take their engine in as well? Their engine 8?
Yep.
Thank you, Madam Chair.
welcome.
Thank you, Chief.
Any other questions? Councilman Johnstone.
Hey, Chief.
Hello.
Going back a year, I remember you and the other chiefs were kind of in this same limbo of a situation. As I'm looking here under the FEMA grants and just thinking about the grants in general, I remember you guys going through and being involved, especially with Chief Scaffarello, and then you guys, we had that big thing with Lowe's with the smoke alarms because
Right.
the grant got held. So where do we stand in grants in general? Because I remember you and the other two, there was this big kind of hold on a lot of grants in the state for a while, and we were kind of scrambling. So just out of curiosity, based on your specific situation with your specific needs, where do we stand for grants for you specifically in Allingtown?
We've gotten almost everything we need that a grant would cover, except for SAFER. I opted not to follow a SAFER grant this year because, give me a moment. They're very competitive. I forget all the numbers, but the amount, there's over 1,586 applications a year to go in for a safer grant, where in the average, I digressed. I used to have the numbers in my head. The point is, for me to go for a safer grant this year after the center, which is also West Haven Fire Department, I'm City of West Haven Fire Department, and that shouldn't really matter. But when the grants people take a look at it, well, let's look at Connecticut. They look at it per state. How many are we going to give? And it goes per capita. So these grants are about 32, 34 pages of application. Takes a good month to prepare. I said, the center already got one. We have some extra boots on the ground there. For me to develop another one, I know I'm not going to get it because they already had it for Connecticut. So, I mean, just in the past 3 years, there's only been one other community in the state in the past 3 years that received the Safer Grant, and that was Southington. Nobody else got it. So I didn't bother this time.
Okay, but other than that, we're looking pretty good.
We're looking pretty good. We're waiting for the delivery of our new subscriber units for the radios. That grant I hosted through the city with the 2 fire districts as recipients for new radios. They're coming in. They're a little delayed. They were supposed to be coming in around this time. We're looking at another month, but that's all new radios, putting us to digital technology. Right now we're analog. We can't effectively use them the way that all the acronyms I refer to, NIOSH, OSHA, NFPA, we're not using them the way we're supposed to because they're ineffective. These new radios are going to allow us to do that. So we have new radios. We received new SCBAs, the tanks on our backs. I just received money for new SCBA bottle refill system, which we're still waiting for. What else? I put in for a new gear extractor. Probably get that. Just before I arrived here, Chief Esposito put in a grant for a new pumper. So we got that. We have over $2.5 million just that I'm a part of and for us. We can't go for gear. We need new gear. We need to have 2 gear for all of our firefighters for this new act that the state passed. Because when you're washing gear, you need to have a spare set because it takes a good 20 hours to do it properly. So, and gear today is over $3,500 per set. So, but the federal government won't give us money for that unless they're over 10 years old. And we've been on a regular basis replacing 5 sets of gear every year. So we don't come up with one big bunch. You don't want to do it all at one time because then in 10 years, you got to do it all over again at one time. So we're pretty good right now.
And then my final question, going way, way, way back. This is just a question of curiosity, which I think I know the answer, but I need you to confirm it. Going back to the fire hydrants when they're damaged, you said roughly $9,000, and then the insurance gets processed, and eventually the insurance sends you the check. Correct me if I'm wrong, when you were talking about the reimbursement process and having that specific line item, am I to assume in the past that when that check came in, it went to that abyss creature called the general fund, and because you did your job, you still didn't see it come back into your line item? Is that accurate?
Would that be accurate? No? What do you got? You're the one that handles that.
Excuse me. Chief, can you come to the podium, please? Thank you.
First of all, when we get the money back, it's $1,000 deductible.
Okay.
$1,000 that we have to pay for that we don't receive. But when the check in the past came back, it was somehow put back into that line item.
Okay, so nothing ended up in the general fund.
Nothing disappeared,
okay.
But we always, however, the transfer or journal entry, whatever you call it, that's how it went back to where it had to go.
We worked with the finance director, and we explained that problem. How do we replenish this? And we weren't able to get quite an accurate answer until I spoke with Dave, and he said, we'll just make a journal entry, put the request in, and we'll get it back in there.
Okay, good, because I know we've heard we've heard horror stories, and I know you guys are working your tail off. And even though to some it's like $9,000, well, you add that up 3 times over the course of years, it's not fair to you guys. So I'm just double checking.
It just takes time because it's kind of like, it's not shoving money around per se. Working with the finance director in the department, they hear our needs and they're addressing them as best we can because we had that exact concern like you just shared.
Okay.
But we've affected it.
Okay, good. Thank you. That's all I have. Thank you, Chairwoman.
You're very welcome. Any other questions for Chief Trenzio? Seeing that there aren't any, I'd like to thank you, Chief Trenzio, for answering all of our questions and for your presentation as well.
Thank you very much, and thank you for your support. And
Thank you.
thank you.
Up next, we have the West Haven Police Department, Animal Control and ERS, presenting Chief Perno.
I believe Acting Director Kate Picellio is here for ERS, so I'll just do Police Department Animal Control, if that's okay.
Absolutely.
Sure. Thank you for this time to answer any of your questions on this slim budget.
Thank you, Chief Perno. Does anybody have any questions for Chief Perno regarding this budget? Councilman Donovan.
How you doing, Chief?
Councilman?
Very sharp.
Thank you, sir.
In your budget, I know we've had conversations before, but in your budget, is there anything in your budget that, and I just didn't see it in your budget that you're looking for? I know you were talking about maybe another buggy for the beach or anything. You don't have that in your budget, correct?
No, sir. That we're going to go to other funding for that.
All right, because I was going to say it's not in there, so we might
Right.
be able to grab from another pool of.
Yes.
Good. Is there anything else that's not in this budget that as a wish list?
I'm very glad that you asked that.
Should I omit that? Should I? I didn't want to be here till 12 o'clock.
It's your question. We have several things that we rely on grant funding, and the grant funding is basically drying up for these things. There is a yearly endowment grant called the Burn Grant, which is named after a police officer from New York City who was assassinated while watching a witness. And at one time, probably 10, 15 years ago, it was the City of West Haven Police Department, we would get in the area of $40,000, $45,000. Now we're down to $14,000 or $16,000. So we allocate most of that to technology because most of that technology has a quicker end of life than anything else that we deal with. We have in the police department 120 computers that are going to be end of life usefulness by June of 25. So we were going to go out and get our grant writer's help and try to get some grants for that, as well as using the Burn Grant when that opens up probably. Usually in October, we don't see any of the funding until probably February, and that would be cutting it short. We're going to look at other funding. So if there's any wiggle room at all with any kind of increases for this type of purchase, it is a lot, but it's 120 computers. We're planning on purchasing 21 of them just to get us by. But we run on a Windows network or format, and the computers that we have right now will not be able to run all of the Windows 11, which is what most of our software programs require.
Okay, and a couple other things I noticed
Want a
on
price
here.
on that one?
What's that?
You want a price on it? I got a price for
On the buggy?
No,
Oh.
on the computers. It's $105,000
For oh, for the
computers. $105,000 for 20 computers.
for 20 computers.
I'm sorry, for 120 computers.
But you're looking for a grant for that you said though, correct?
We're
Applying-
hoping for a grant. We're
Okay.
not.
Right.
We're not sure that is out there.
Right.
But the problem is, we have the 120, and if we don't get a funding for all of them, we're going to have some that's not going to be useful.
The software licenses, that's the normal cost. That's just the price of the upgrading the software, correct?
Yes,
For
that's
all your computers and.
that's license fees for the software and software programs that we currently have.
SRT equipment. Can you just? What is SRT? I'm sorry.
SRT is our special response team. They have equipment that also has end of life things, gas masks, filters, etc.
And we have, if I remember right, spots for 123 police officers.
Correct. Currently staffed at 113.
We're at 113 now.
Yes. We have 113 bodies. We can only use 103 of them. Between those that are in training, those that are out on workers' compensation, we only have 103 available bodies.
I know we lost one that day I was at the meeting.
Correct.
We lose any since then?
No, sir.
Not yet.
We
Hopefully not.
lost one through in field training. He resigned while in field training for
One of the
personal
new-
reasons.
One of the two new ones that were?
No, sir.
Oh, okay. This was another.
Correct.
That's all I got for now. I'll save some for others, I guess. Thank you, Chief.
Councilman Locks.
Thanks, Madam Chair, and thanks for coming in tonight, Chief, and everybody else. In terms, how many officers are you currently short?
10.
Oh, so you're only short 10.
I wouldn't say only.
No, no, because
no, we have 113 officers on the payroll.
A point of order.
But we are budgeted for 123.
Point of order. Councilman Locks has the
It's okay.
floor.
The only reason I said only 10 is because when I was campaigning, of course, not knowing much, I heard the number was 23. So, for me, it doesn't appear as bad because I thought 23 was a lot.
That may have been the available bodies
Yeah.
that we had.
Who knows? Listen, it was bathroom chatter. So I guess with 10 not being all that bad, what do you have dollars in here to cover that recruiting expense and that sort of thing?
Yeah, it's in the budget under.
I saw the minority recruitment piece, but in terms of recruitment expense in general,
That would come under the actual yearly expense comes under training and education.
Okay.
That's a fee that we pay South Central Criminal Justice as well as the International Association of Chief Police to do our recruitment. As far as the minority recruitment, that money is spent on job fairs and anything else that we're invited to.
Okay.
But getting back to the 123, that 123, that's a spot for everybody. So when you're down 10, you're down 10 spots. So I don't have 10 people, and that is the driving force for the overtime. Because 85% of this budget is contractual. I only have between 17 and 15% that I can play with.
Okay. So in terms of the recruitment piece, I've heard a lot of things. It's salary, it's pension, it's all kinds of things. What are those big drivers in terms of retention and getting people to come here?
It is the pension,
Okay.
but that's also an issue of having people stay here. So if you have a new recruit that comes here and he's here and we train him and he's certified, now he's a tremendous commodity. So other departments that have a higher pay or offer a pension, which now is the driving force to leave, they can be recruited by that and they can go there as a lateral transfer. Other departments offer their lateral transfers a stipend upwards of $20,000 to $25,000 over so many years. We don't offer that. But I must say that not even having that, not even having a pension, we have 3 laterals in the process right now to come here because this is such a good department. And I give that to my command staff, some of which are here right now, and my commissioner. So the driving force is the tentative agreement, which is at MARB.
Right.
That is the thing that is actually the wait game. Everyone is waiting. I have my veteran officers waiting to see if there is something that will benefit them to stay, and I have my 401 officers wanting to go someplace that will offer a pension for them in the event of, God forbid, something happening and their family is protected. So that is what will actually have something to do with that overtime budget that you see in front of you. It's either going to be way too much or way too little, depending on the outcome of that.
Okay. Yeah, I guess, listen, I'm the last one who does not want to see the police department in the city of West Haven fully staffed. But I guess my thing is I would love to see, well, I'd like to make sure that at the end of the day that you have enough money to cover that recruitment piece. I don't know where you try to draw from. I use this as an example. I tell people all the time, like, up in Providence Place, I go up there Christmas time, go shopping, and, there's billboards for the New Haven Police Department recruiting people. So, they're obviously they must have the same issue you have.
Everyone in Connecticut.
Yeah, and I just hope that, you have the dollars so that you can properly recruit so you can fill your gaps. That's the only thing I wanted to say. My laptop just died. The other big thing is the telephone expense. Is there any opportunity with the entire city to get on one provider, one contract? Anybody have is that a bad question? Does anybody have a feel for that?
I'm just trying to get my telephones to work, sir. We have funding that the mayor, when she was state rep, got us, and we also have some budgeted funding. We just had I believe probably maybe 2 or so weeks ago, we had the bid opening and we had the walkthrough of all the vendors, et cetera, and that's just waiting to get up and running. But there are other things that are putting that on hold that are going on within the building that I explained to you last night, that we're just not going to be putting one thing in to move it to put something else in. So our telephone system will be state of the art, I've been told. It's just a matter of time. As far as the bill, that's the guy you got to talk to about that. So.
Okay. Thank you very much.
Thank you.
Yep.
Chief Perno, your longevity pay, is that only for your officers with a pension?
No, I believe some of them on the 401 get longevity. Do they not? Yes.
Under the 401k as
401
well?
also.
Okay.
That's basically tenure.
Okay.
As many times years on the job you get.
Thank you, Chief. Councilman Heffernan, did you want to add? Absolutely. No, that's fine. Yes, please turn your, you just have to turn your mic on.
Sorry about that.
No, it's okay.
The firearm supplies, they went up significantly.
Correct.
Is that
There's
ammo or new weapons or?
We got new weapons. We got lesser costly ammunition. However, there are several conflicts around the world which is driving the cost of ammunition up.
That's significant.
Yes.
That's all. Thank you.
You're very welcome. Councilwoman Coletti?
Thank you, Madam Chair. Hi, Chief. would you be able to elaborate on the 52770 other contractual services?
Other contractual services deals with any outside piece of equipment, such as copiers, things of that nature that we have a contract, and it's sometimes it's a monthly occurrence, sometimes quarterly, sometimes it's once a year.
Any idea why it's gone up 37% from 145 to 200?
A lot of it we got a couple new things, and the other issues about it raising the prices is everything is going up.
Okay, and I know Councilman Donovan also asked about the software licenses. I believe it went from 24. Let me see. Sorry about that. From 10,000 to 37,000. That's just due to standard increases in licensing fees.
Yeah, that's, and also that was what we projected. So with all of the new things that were purchased that have all of these software licenses, we thought that it was a fair amount to budget for.
That's it for me for now. Thank you.
Councilwoman Tucker.
Hi again.
How are you?
I'm good. How are you? You look very nice.
Oh, thank you.
Questions I have are, what is professional STDS assist? What is that? What does that person do?
Are you looking under
personnel?
Personnel. Let's see. What's my
professional STDS assistant?
And where exactly are you? Oh, professional standards assistant. Under the police accountability bill, we have to be accredited, and we have a civilian employee who has gone through all kinds of training, and this person will put all of our general orders as they need to be. We'll put anything that is coming down, because the post sometimes changes it twice a month, and they'll do different formats and different criteria as to what is needed in our general orders. She keeps an eye on that, and she also does anything for our crime statistics.
Okay. So it's a clerical
Yes.
kind of role. Okay.
I should have said that.
That's okay. And the other questions I have are around, this was asked earlier when the fire chief was here, but psychological testing, and then it says other examinations. So I'm assuming those are both physical examinations of some sort or health related, correct?
That's twofold. It's psychological examinations for a recruit coming on the job.
Okay.
That recruit also has to have a regular medical examination as well as a polygraph.
Okay.
And then again, to the police accountability bill, there is a wellness psychological test that is done for 25% of the department yearly.
And again, why would they not be covered by insurance? I don't know.
I don't think any insurance covers a psychological test. But this is
well, they
mandated.
gave the I know he gave the example earlier when the fire chief was here that was a misnomer. They weren't called psychological tests; they were called physical.
Oh no, ours is. We have
Yours
a
is
psychological test.
Okay. Okay, you mean it.
Yes.
Got it.
I say that because it's very expensive, and they know that you have to get it, so everybody's raising their prices also.
Okay.
The polygraph test, we have to go to an examiner in Lebanon, Connecticut.
Oh, wow.
So that's a trek.
And we talked yesterday about, potentially having some kind of like programs or something like that. Where in your budget do you have, or do you not? I don't see anything in here, obviously, but where would it fit in your budget to have something like All right, I'll start from the beginning because I have to be careful.
I'll answer the question because I know
You already
exactly
know where I'm
you-
going.
Yep. We go after grant funding, and the state puts it out there. We have this amount of money. What do you want to do with it? If you can come up with a good reason, they'll look at it and give you the money. Mayor Bora was very instrumental in getting us some of that money. We have $10,000 that we can use for youth programs. We're going to have a bicycle safety day and use some of that money there. So if you if you start that and you start to build off of that, then you'll have more ideas that you can go bring to the state and say, listen, we did this. This is what we want to do. And my goal, going back to Councilman Locke's thing, I can't do that as often or as even any kind of steady basis because I'm down those 2 people. That's 10 people. And I got to worry about filling those 10 spots before I can put 2 or 3 young guys that want to get out there and play basketball or soccer with the kids on any kind of, maybe once a month, twice a month, take them out the whole summer.
Right. So I was thinking more. Thank you for that, and I appreciate what you're saying. I'm just thinking strategically about next year for spring break.
Yeah.
So we don't have a repeat of what we just had, a couple weeks ago.
Well, I'm sure the Board of Ed is listening, but I'll take any kind of money that they'll give me for that.
And maybe it's a collaboration, but I'm just wondering whether or not there's an opportunity to kind of have some thoughtful, planning about what we could do to prevent a recurrence of what happened a couple weeks ago by planning now for that.
How would this council feel if we went and got sponsors? Yale, UNH, any of the other businesses, just to try to offset some costs. Sure. I'm very good with getting that done.
You like it, I love it. Thank you.
You're very welcome. Councilwoman Callahan.
Thank you, Chairwoman. Good evening, Chief.
Good evening, ma'am.
And thank you to the whole department for coming. We appreciate it. And well done with the budget and questions asked. The only question I had, and maybe because I need to be educated on this, the intercity police extra duty up 100%. Is that just because of your shortage of?
No, that's a specific line item that pays for any of the police officers at any of the city-held events, from the fireworks to any of the festivals. It also covers, because it used to be a separate, but now it's all in one. It covers anything that's a Board of Education event. So hockey games, football games, basketball games, dances, stuff like that. That comes out of that fund.
That doesn't come out of the Board of Ed fund.
No.
So they wouldn't hire you out and take that money out of their funds to hire you for their events.
The way it was presented and why that fund was actually developed was because it's the same wallet, just a different compartment. So where they used to have a line item in their budget for security, meaning all of those events that I just spoke of, that is now, my opinion or my understanding, zeroed out, and it's funded in that.
Okay. If it was a private event and the public or the community hires you out, that's not under this. That's.
You mean like what?
Say I was having a block party and I wanted to hire you out to.
We just let you have the block party. You wouldn't have to hire us.
Everybody heard that. Thank you.
Councilman Johnston.
Hey, Chief. One, you'll be happy to know I checked the score for you. The Rangers are up 2-1 at the end of the first period.
Thank you very much, sir.
So thank you for being here. I know it's killing you. Going back to the firearm supplies, because you and I have had this conversation, and after one of my ride-alongs 2 years ago, you guys are using the red dots now, right? That was the weapon you guys had shown me, the red scope added. I forget the technical term for it. That was the new firearm you guys got, right?
No, we have one that is compatible to, but if an officer wants that, that's his purchase.
Okay. So the conversation we've had before is, the cost of everything's going up and the cost of ammunition's brutal. Does what you're asking for Because the problem you expressed to me, and a lot of your other officers have as well, they've had to take money out of their own pocket. If they were to practice in your range, they have to purchase their own ammunition because you don't have the budget for it. Is that still the case? Is this number going to help cover their training ammunition to stay sharp, or do we need more for that?
Yes and no. Yes, we do not provide ammunition for them to practice on. And yes, we do provide the ammunition when they qualify.
Okay.
However, there's several thousand rounds of ammunition that goes per officer up when they're in the academy.
That's what
Several
it was.
thousand rounds. And that's what the academy requires we send them with.
Okay. And lastly, I'd hate myself if I didn't recognize it. I apologize for kind of going off script. There's an individual here who we heard about in last night's meeting, but he needs to be recognized. He pretty much kind of led the charge with everything that went on last week, and that is Lieutenant Massey is sitting currently over there in front of Lieutenant D'Amato. Sorry, Lieutenant. I know you're hiding behind the door, but I had to recognize you. So
that was my ending. So
thank you, Chief. Appreciate it. Thank you, Chairwoman.
You're very welcome. Councilman Vargo.
Thank you, Madam Chair. Thank you, Chief, for making us all feel completely underdressed tonight. And thank you for everybody for joining.
That was my intent.
You succeeded. Just my own personal ignorance. I see that there are multiple categories or grades of positions. There's Patrol A, B, and C.
Correct.
Can you just explain to me, for my own ignorance, what the difference is? Is that different experience levels?
Yes, it's a new recruit comes in as a grade C.
Okay.
After requirements, they go to B and then to A.
Okay. So I see that your 10 open patrol officers are all on grade C. Is there enough funding in your budget that if you were able to procure a lateral at a higher grade, do you have that flexibility?
Laterals come in at grade C also.
They do?
Yes, sir.
Okay. So it's the number of years experience in R?
In R. You have to work for us to get that increase.
Okay. I also see, in addition to the 10, you have other open positions. You have 2 detectives, open positions for quite a while, a detective sergeant, I think that's it.
That I personally put in there, and I thank Mr. Taylor for allowing me to keep doing that. That is to show this council and anyone else that is asking what it was prior to 2009. 2009, there was 4 detective sergeants. There were 18 detectives. Now we only have 16. I have detectives, as Councilman Mackey can tell you. We have detectives that are specifically assigned to specific crimes and instances that I wouldn't want anyone here subjected to. Am I correct? Those detectives are our specialized group, and we don't usually use them for anything else. But that also leads me to say now the floor detectives, I'm 2 down, and we've been working with 2 down since probably 2015. So I have 3 detective sergeants doing the work of 4. I have 16 detectives minus those that are in that specialized unit doing the work of 18. Now, add on to that, I have 67 patrolmen doing what is funded for 77 patrolmen. So that's where the disconnect with MARB, that's where the disconnect with a lot of people is that that 10 positions, there's somebody not going home that has to be forced to work. So they're missing birthdays, they're missing going out to dinner with their significant other. There's a lot of things that they're missing, and that takes a toll on an individual. And maybe they get a little grumpy. Or maybe they say, you know what? I don't want to come in tonight. I need a sick day, quote unquote mental health day. Can't stop them. It's contractual. So now that also causes a shift that is open. So it's a trickle down, up and down effect.
And you call somebody in who might have just come off a shift or the day before, and it's overburdening that individual as well,
Yeah.
correct?
Or you come in at 7 in the morning and you don't, they tell you at 7:30, are you staying until 11 tonight? And then you got to be back in the next morning at 7.
Do you presently have any officers out on short-term disability or workers' comp?
2 officers on workers' comp? Oh, 3. 3 officers on workers' comp.
So in addition, so that's now 13?
That's that brings you down to the 103 number. That's not going to be there. I'm just telling you that. There's 103. If something happened right now, I only have 103 officers I can count on.
Okay, so that's when you said you have 123 spots.
Yep.
113 are staff, so that's the 10 that's vacant. But you have another
10
that are
not available.
Not available to you.
Yep.
So essentially, your department is 20 officers.
Correct.
Shy right now.
Of that, we have several that are in the academy, 2 that just graduated a week ago tomorrow, and we won't see them for another 11, 12 weeks. The ones that we hired that went into the academy 2 weeks ago, no, a month ago, 2 West Haven kids, I might add. We won't see them on the road by themselves probably until next spring. So out of this budget, I'm paying 9-10 months of salary, getting nothing in return. And then hopefully 2 years later, they're still here where they don't leave. Because believe it or not, there are other departments that they go out and they look for West Haven officers simply because we are so well trained. And I don't say that in a boastful way. That's a fact. We are absolutely the best trained department I have ever seen in this state. We train and train and train, and to our detriment, sometimes they say, "Oh, we got training again this month." Well, yeah, you do. There's a lot of things change, from de-escalation to use of force to deadly force. Everything changes, and you have to be sharp.
When I went on my ride along, which was an absolutely fantastic experience, and you know who I
missed the day. You were day early.
It was the day early, and I was you texted me, and I was very frustrated. The officer that I was with explained to me what happens during a traffic stop or another stop, and how some officers are relocated to provide support. Is 123, assuming that you're able to get to that number, is that an ideal number, or is that still a low number?
123 is having a body in every spot, having a name associated with an assignment, a position, a rank. That's the 123. There's no wiggle room there. I don't have 4 or 5 guys that I can just say, all right, let's go plug them in over here. No, if I want to do the shore patrol, I got to take away from something else. I have to wait until the SROs are out of the school, so I have those bodies to supplement the bodies that I want to put down at the beach. We're putting 2 bodies down at the beach, as I said, May 20th, but on a day like the other day, that's not enough. So maybe we're going to do 2 more at overtime, just to have enough, just to have another 2 sets of eyes.
And my last question is, and this might be an unfair question, but aside from the pension, what else can we do to entice officers to come to us and to stay with us?
I think a lot of it you've already done. You don't even know it. Your support and your backing of the department and the officers individually means a lot. You don't see it. You're not going to see it. But just your being there, and just the mere fact that you're not bashing them, that you're not you're there for them, and that goes a long way. It really does. And like I said, you're not going to see it because they're not going to, they're very honorable. They're very humble. They're not going to go up to you and look for gratification, but you giving them that appreciation is very, very well received. I thank you for that, because everybody says, "Oh, thank you, Chief, for a great job." No, don't thank me. Thank the guys on the street. Don't thank me. They may work for me, but you got to thank them for doing the job.
Thank you, Chief, and thank you to everybody in your department.
I will. Pass
Thank
it
you.
on.
You're welcome. Councilman Heffernan. You're welcome.
No, the police cars will not be red.
I was say no. Well, that's a shame because it is my color. And if I was going to go on a ride along,
Yes.
I would like it. But besides that, I have in the past gotten requests for DARE funding, and mail checks in for DARE. Is that I don't know what your funding is like, but you mail out the requests, and sometimes
Not from us.
No.
No, that's the DARE organization. We gave up doing DARE for several reasons. Number one was the cost. If you were going to buy a DARE pencil, that cost, you can buy 100 pencils for the cost of 10 DARE pencils because
I'm glad
you're
we
paying.
don't have to write 2 checks then.
So yeah, no,
'Cause instead of writing it for DARE, could we have like a youth fund? Like if you mailed out like not a capital campaign, but just you mail out, hey, I'm detective.
Well, Mr. Taylor, can you make a line item that rolls over year to year that we can have this
Is that a
for?
big ask? I don't even know. I'm sorry.
Yes. Yeah.
You know what I mean?
But what I would like to have that just earmarked specifically and not to be used for anything other than youth organized activities.
Like a letter,
Yeah.
sent out to, 20,000 people. Maybe each get $1, and it's $20,000 for, youth programs during spring break. Or a party. I remember
Yeah.
I loved your parties. Your parties were great. I
My
know
party.
parties.
We had that a long time ago.
I know, and I liked it.
Yep. Well, no, the
Not
police
that kind of
department-
party.
No, that was funded by other means. So none of which are still around.
Oh, well, that's too bad. Because that actually, we got to see the dogs. You had the canine units out.
Mhm.
And, I'm sorry. Pardon me. Thank you for that.
Councilman Callahan.
Thank you, Chairwoman. Hard to follow that one. You can come to my block party.
Thank you.
I had a question. As far as street signs go, stop signs, is that in your budget? Is that part of your department? Or I was just curious where that
Yeah.
comes from. What is that? What category is that under? And is there enough for
Traffic
you?
Supplies?
Is there enough in there for that?
Nope.
Okay. Good. I'm glad I brought it up. How short are we?
Well, we've been putting off changing some of the signage to meet regulations.
Mm-hmm.
Plus, some of the street signs, they're showing their age.
Absolutely.
We try to get by if somebody knocks down a stop sign or somebody steals a sign, that'll get replaced eventually. But yeah, we can always use more in that simply because we can do more with it.
I asked to, not just because, a lot of them are aging and, the beautification part, but the safety part. So
Right.
as they age
They
and
lose
you're
the
coming down the
reflective
street,
properties.
you don't really, there's a stop sign. And again, I think the city's been really good, whereas if we report like there's maybe a overgrown tree or limb in the way, it'll be taken care of so that the ongoing traffic can see that stop sign as well. So I guess lighted stop signs are out of the question. I'm saying, like I saw one, and it's night and day from where I stand to watch the speeding cars, and then they see that from a distance instead of when they just come up to it, that they're actually slowing it down.
They're a wonderful tool. They're a luxury for us, though.
Right. So it's definitely a line item that we can.
You have the pencils. You can do whatever you want.
Okay, duly noted. I appreciate that because that was one of the things that came up with the speeding on the streets, and thank you for that and helping with like traffic studies and stuff because not all of us are educated where just simply putting a stop sign in the middle of the road is going to help. So myself included, I've gotten educated on that. Thank you. I think you've helped me with that, and also I have seen a couple officers out now monitoring those streets that are brought to our attention. through constituents in our neighborhoods, and it's I think it's an important thing that we, just take a note of it for future reference for the line item for those stop signs and other signs needed in that department. So
Appreciate that.
But thank you all for helping with that as well, because it does help. And I did thank the officer that I saw that was helping to monitor that situation. So thank you again. Thank you.
You're welcome. Councilman Tucker?
Where the city ends and like between the line between New Haven and West Haven, Marginal Drive, that area.
Mhm.
Do we respond to incidences that happen there, or is that New Haven's territory?
There is probably an ancient agreement that we respond to crimes, but the upkeep and associated things for that are New Haven Parks Department.
Yeah.
But if there's an accident on that road, we take that, or if there's any other criminal activity, we take that.
But technically, that's New Haven.
No, it's New Haven property in the district, in the city of West Haven. From the West River to Marginal Drive is the New Haven Parks Department, as well as the Horseshoe Lagoon, which is down there. That's New Haven Parks Department, and some may even tell you that it's Regional Water Authority, or whatever they're called now.
Mm-hmm.
But that's the New Haven Parks Department. They have jurisdiction over that land. However, anything that happens on that land in a criminal nature, we take care of.
Why? I don't understand.
That's a very good question. That's been like that since I was a kid, so.
Okay, because that just makes things very complicated.
Yes,
very
it does.
confusing. Okay, and then the other question I have is because there's a lot of unhoused people, especially in that area, and what responsibility do the police have when it comes down to relocating unhoused people, or do you have a responsibility in that space?
We've gone down there and offered. To be quite honest with you, some of them are so set in their ways that they want to stay there.
Yeah.
We offer any of the warming shelters or cooling things that come up,
Yep.
but they're within their own, and a lot of them can take care of themselves in that element. When we have something that we see that is or comes to our attention that something is going on down there, whether it be good or bad, we'll go down and see if that's the case. But Columbus House or any of the other homeless shelters, they're not really interested in going to, and we don't have anything yet in the city to offer them.
Yeah, that's what I was getting at. We don't have anything
No.
to offer unhoused people.
And the only thing that it comes to sometimes is that it's a medical issue, and now they're at the LER.
Mm-hmm. Thank you.
Councilwoman Mueller. You're welcome.
I was just wondering, do you have a canine unit that you use for, say, crowd control?
Yes, we do.
Oh, you do?
We have 2 dogs for that. We also have a canine that is narcotics trained.
Yeah.
And if things go the right way, I'll have a 3rd dog in the fall.
I think just they're very effective because I worked in correctional managed health care as a nurse, Cheshire Corrections, and we use them a lot.
The shepherds are cross-trained. We have one that is both personal protection as well as narcotics. That's Otto. And we have one that is personal protection and weapons. That's a secret, but and that's Jax.
Thank
And
you.
Hanny is our yellow lab narcotics dog, so sweetheart.
Thank you. Councilman Heffernan.
I just wanted to go back to the signs. The wrong way driving has been kind of an issue. I know not really, mostly highways, but Captain Thomas Boulevard, I've seen it happen quite a few times where people are going down the wrong way. And thankfully, I haven't really seen any accidents, but it's happened on Wagner Place twice in
Yes.
the last week.
Yes.
Like, to me.
I've personally seen it, yes. And
And-
Wagner, coming off of Main Street,
Yeah.
making the left.
I mean,
Correct.
it's happened twice in a week. To me, I mean.
Well, you got to pay attention.
No, I'm not. I know you would assume that I am the culprit. However, I'm getting a lot of heat tonight. Wow. But
I can do that. You're my district person.
I can take it. I have big shoulders. But they have signs. I was thinking it more not for Wagner Place, but for the Captain Boulevard. But when cars are going the wrong way, signs light up. And I don't know if they're solar powered or how they're powered or how they're programmed, but they are programmed for if someone's driving the wrong way down the street, they do light up.
I'll have my traffic sergeant look at that and see what
I
cost.
mean, like I said, it doesn't really happen very often where it's a big accident, but I mean, I can see it happening at night down there. But anyway, thank you.
All hours,
I
yeah.
didn't know if you'd heard of them or if they were on your horizon.
Councilwoman Coletti.
Thank you. To piggyback off of that, when Public Works was here, we did also ask them about signage and signage replacement, not only for beautification, but also more so for safety, and faded one-way signs, etc. So I think we can or perhaps the departments want to look collaboratively at that. As far as traffic safety, can you just quickly kind of run through, and there's a point to it, what's the process if kind of there's a complaint in terms of signage or street safety, whereas the city might have a traffic engineer and West Haven does not. Do you refer out and do you mandate like a third party study of the situation, and then it kind of comes back and you approve any changes and signage or ways of improving pedestrian and traffic safety?
It actually depends on what the issue is. A lot of those things, the guidelines, you have to meet the criteria of the National Traffic Safety Board, and they'll tell you what you can and can't do based on an intersection and the issues that you're asking. For instance, you may think that you can put a stop sign up to stop speeding because of a long stretch. I'll use Savin Avenue, for example, but it doesn't meet the criteria to put a stop sign there. And you need to have X amount of accidents, and the cause of the accidents would be somewhat mitigated by the stop sign. You can't just use a stop sign for speeding. If it's another thing as far as line of sight, well, what's causing the line of sight issue? Is it bushes, trees, something like that? So it all depends on the issue as to what the guidelines are as to how you can mitigate that and what piece of equipment you can use to put there.
Okay. Thanks, Chief. And then just one more quick question, kind of back to the inner city police extra duty. In 23, it was around 660,000. 24 was 200,000, and now this request is 400,000. And I don't want to assume, but I think that's probably due to what you were talking about it being kind of moved back and forth.
It's a projection for the FY25, what we have historically spent. Some of them were driven by certain things. We had the Chestnut Street sewer problem that was paid out of that for the police protection. Back in 2020, when there was nothing going on, nothing at all, it was probably a little less. But the driving force was the making sure that there was nothing going on. There was the issues on the beach. So when we put people there at overtime, that's where that is also comes out of.
Okay. And then last question, under police department support, 52570, other repairs and maintenance upgrade. 24 was 50,000, 25 recommended 75,000. Can you elaborate
The other
on that
repairs and
item?
maintenance covers basically anything that happens to a vehicle.
Okay.
A lot of the things that have brakes on a vehicle, it gets replaced. A lot of the things that we had were too old to fix, so we had to actually replace them with a new unit. So we're just phasing out, and at some point in the near future, we'll get to a level where the things we have a little bit more life expectancy, so we're not replacing the lights or anything like that on a yearly basis because of just the use.
Got it. Okay, thank you very much. Thank you.
You're welcome. Any other questions? Councilman Pascal.
Thank you. Thanks, Chief. Thanks for being with us tonight. You look positively dreamy. On page 65, medical services, how is that line item used?
Medical services is anything from, let me make sure that I got this right. That covers anything that is not an exam. However, it does cover our drug testing. So if we have the Stericycle for the sharps containers, we have all of those things. That's what that's the funds that covers that. But the driving force, the big thing, is the drug testing.
Okay.
It's both police accountability and contractual. We have contractual random, and we have the police accountability, which requires X amount per year.
Okay.
So I personally went 2 months in a row. So both the random and the accountability. So.
All right, that's fair. I also noticed on the 52040 that line item's been zeroed out. You sure those pagers aren't going to make a comeback?
No, I think we can do without those.
Okay. What's the communications portion of that, seriously?
That was things that we gave to the police commissioners, but we took away from them. So that was also zeroed out.
I don't think I want a further explanation.
Nope.
That's all I have for you tonight. Thank you.
You're welcome. Any other questions? Councilman Vargo.
Thank you, Madam Chair. The end of life technology replacements I see on page 125 for the 5-year capital bonding request. You're budgeting $50,000 for bonding each year from 25 to 29. Is the computer replacement part of that, or is that other equipment?
That a very small portion of that would be going to the computers, because we're looking for other ways. That is for things that, to be honest with you, that we don't know about right now. That by the time it breaks and we call somebody in, then they say, "Oh, we can't fix it. It's too old."
So these are anticipatory.
Basically, yeah.
Okay. And then you plan to bond and replace 6 vehicles every year?
Correct.
And that's just to rotate them out of service and recycle them for another use within the city, I assume.
Pass them down
like
to whoever else.
A hand-me-down type?
Yep.
Okay. And then the 122 body cameras and tasers, 250 bonded in FY 27, 28, and 29. Is the 122 staggered over those 3 years?
Correct. That's mostly storage. We have a program right now where I believe the next several months we'll be getting brand new, state-of-the-art, their newest model body cameras. But this is the last time we can get that. So
That's a grant you said, I'm sorry?
That was a bonded for also.
Oh, okay. I'm sorry, well, I missed it. What was the funding source for that?
The funding source for the initial purchase was the bonding. This is it built out over the 5 years.
Okay. So for the in-house computers that your staff uses, that part of that is in this budget, but not the full amount that you anticipate needing?
Only the ones that we don't know are going to break is in that 50. We didn't budget for the. You're talking about the 21 that I was talking about?
Yes, sir.
We're going to get that someplace else within the budget. It's simply because we have to.
And the remainder that you anticipate needing, that's you have to work on that?
Well, it's like everything else. When you find something and something else breaks.
Yep.
So
Okay.
we're anticipating that when they put the new program on some of the computers, they won't be able to sustain it, so that becomes a paperweight. So.
Okay, thank you.
Any other questions? It's okay. Councilwoman Callahan.
Just a quick question. Thank you. The cars, when they go out of service, Chief, is there any way, or maybe you might already do this, that what happens when the cars are done, like totally done, out of service? They just get recycled, they get a new vehicle. My question, my ask is that with the ones that are aging and at that level, is there any way to just kind of put them around town in areas that are kind of, in more troubled areas than not, and stage them as, I don't want to say the word...
a decoy?
Yeah.
That would probably last maybe a day or two doing that.
So they figure it out?
Yeah. And
just a thought.
We use the cars so much and so far into their life that when they go up to the College Street, they go into the back and they call it the boneyard.
Mm-hmm.
So it's sometimes they even have to be towed out of our lot to go up there. They're that aged.
Wow.
We have how many Crown Vics still? 4. Yeah. We're still nursing some Crown Vics.
No kidding.
They stopped making those in 2011.
Yeah, it was just a thought, like instead of going to the boneyard, placing them strategically. But I guess you're right; it wouldn't take long to figure it out. There you go. Thank you.
No problem.
Councilwoman Tucker.
And I would be remiss if I didn't bring up the old camera discussion and funding for cameras. So I don't see anything like that here.
Which cameras?
Well,
body worn cameras or
no,
beach
cities.
City
Cameras around the city.
Not
streets.
in my budget.
So who does the budgeting for that? Because it's going to go into your.
Yeah, I figure you guys are going to stick me with that. I understand. So that is ARPA funding right now, with a 3-year maintenance agreement. Within the 3 years, we're going to see what it is that we need, and hopefully at the end of that, we'll be able to come up with a figure to say, this is what it takes to sustain these cameras, so this is what you're going to have to give me.
So there's nothing that is needed in your
Not
budget
yet.
right now for that?
Not yet.
Not even the installation that goes to the police department?
Nope.
None of that?
All of that is on ARPA's dime.
So next year, we can.
Well, it's a 3-year maintenance agreement, so hopefully we'll know what's going to be and what we're going to need to spend in the 4th year, so we can come up with something. That's already paid for. The 3-year maintenance agreement is already paid for.
Okay. And the cameras themselves, like the additional cameras that we now know we need on the other side of the beach, those are not going to be.
That's going to be supplemental funding, because that's not, unless you come up with something that's underfunded in ARPA, and you can use that money that way.
Okay.
But I do stress that once that is decided, that please include the IT department from the PD.
Okay. Got it. Thank you very much.
No problem.
Any other questions for Chief Perno regarding the police budget?
Gary, don't you have something else to ask me? I got one more thing on my wish list. You didn't get me the answer.
Oh, you
No, you cut me off.
might have been the other way around.
As you well know, that cell phones are a driving force for solving crimes. That's any TV show you watch, anything you see. All right, our forensic unit has one such piece to the puzzle, and they want to get the other piece to the puzzle so that they don't have to hunt other departments down, and it just would be a big tool for them in their toolbox. It's like $12,500 to get, and how can I say this? The person that spoke the other night about a case, this other piece of the puzzle is something that would be very beneficial to my forensic unit for that particular instance. That's probably the best I can say it. Mackie, you know what I'm alluding to. So 12.5 for that, and 105. When can I expect that?
That the bug
You asked me about a wish list.
I did a while ago.
Yes.
You're blowing me off. So I may not want to ask no more.
we were asked to come up with a wish list, and we utilize a vehicle that is housed in North Haven. It's called a Bearcat, and that vehicle's life expectancy is usually about 10 to 15 years, and that's a 2008, and New Haven's is a 2004. I may be wrong with the ages, but we utilize that vehicle more than anybody in the area in this southern New England, southern New Haven. We had, because they're just teasers, we had a company come here from a company called Teradyne, and they offer something that's just like that, only it's a little bit more suited for us because it's, I want a vehicle that can sustain certain depths of water. Because I was here during Sandy, I was here during Irene, and it was something that I have never witnessed before, and I don't want to witness again. So we tried to get the rescue vehicle from the state of Connecticut through a regional team in Bloomfield, Avon, Farmington. We had it here. Senate passed it, the legislative body passed it at Hartford, and the governor vetoed it. Your guess is as good as mine. Why? That vehicle right now is in upstate New York. I can't remember the town's name, but we need something here like that. It's a necessity. It's a very expensive necessity, but we utilize it. We utilize the one in North Haven, probably in the area, not counting the fireworks, probably in the area of 15 to 18 times a year. It goes with us on anything that anybody could possibly be injured upon, whether it's weapons. We specifically, if there's a child and a weapon in the house, that vehicle goes just for that reason, that protection of that child from that weapon, so that we can get in there on an arrest warrant or a search warrant. My request to be considered for if there is any possibility of leftover funding from any of the ARPA programs that you have to earmark by, I guess, the end of when? This year, I guess? Or
next week. But
next
yeah.
week? That would be a huge asset to this region, being housed in West Haven, because we use it more. But it would be something that would be regionalized, that if anybody else called us, Milford, Orange, Woodbridge, New Haven, North Haven, East Haven, they had the thing in Branford when they used it. I would request that you consider that. It is a sizable amount of money. It's $375,000. But I don't know what kind of price you would put on someone's life. But I also like this vehicle because it can traverse up to about 6 feet of water. So we had 3 to 5 storm surge. That's good for me. I'll take that.
Chief, would SWAT be using this mostly, or
the SRT?
Yeah.
They use that. They use the one in North Haven.
So that if anything goes down here, they have to grab one from North Haven.
Yep.
Is that
Sergeant Thompson, who was sitting here last night?
Yeah.
He drives to North Haven and then drives that back. So
Do we pay North Haven for the use?
You're asking me if I pay somebody?
Not
No,
you.
I don't. No, I don't.
Do we,
no.
the city?
No, I mean we meaning. Yeah, they sent
There
us a bill. It goes.
There's no, okay, well, I was just wondering if there was, because then that would definitely, if another town needs ours. then we
Yeah,
can-
absolutely.
We can hit them up.
No,
you know, but
no, we would never say no.
If it's,
Absolutely never say no.
Yeah, no, I'm not saying we would. If other towns are already kind of like letting us use it.
Well, that's a regional asset. This would be our asset that we would allow other towns to utilize with someone from West Haven.
Well, I mean, I'm not saying it's not possible, because it seems like we may be getting more money into our contingency for the ARPA. So
It's just something to consider. It's a once in a lifetime opportunity to get a vehicle like that we would never.
And I did ask you about the buggy. We have two. We have one.
We have one. You're not gonna make me say this again, are you?
No. We need another one.
We need another one. We have two. One is ours. One we
Yeah,
acquired.
Right.
And we are tomorrow morning after a meeting. Deputy Chief and I are on our way up to try to price it out.
Okay. I thought you were going up to grab another one.
No.
But,
Maybe. You never
all right.
know.
Yeah. No. Thank you.
Councilwoman Colletti.
All set.
Thank you.
Thank you. I just wanted to clarify a couple of things that you mentioned. The second item, in an ideal world, was 12,500 for cell
Correct.
phones, and that's just, there's no cell phone expense currently built into telephone expenses in the budget.
This is a software program.
It's software. Okay. Got it.
That's as technical as I'm going to get with that one.
Okay. Okay. And you said for the Bearcat vehicle was approximately $375,000. Is that the cost of the one you kind of have in mind that's located in a? Oh, I'm sorry. 327. Is that the cost that you currently kind of have earmarked?
That's we were shown the model with all the bells and whistles. There's a lot of things that we don't need on that. They're just fluff. This is a one that would be able to be utilized for what we intended for. That one there was over 400,000 that they showed us. Yeah, Suffolk County, New York, bought it on site.
And this is a bulletproof vehicle that would mainly be used in emergency situations that could go in up to 6 feet of water.
Correct.
Okay. Thank you very much. Thank you.
You're welcome. Any other questions? Councilman Vargo?
Chief, I'm sorry. Can you clarify? Because I thought I heard 375 for the Bearcat. Is it 375 or 320?
I inflated it a little bit.
Okay. So I'll write down 375.
Keep that 375. You got it right there.
375. Right. The 12.5 software, is that? No. I'm trying to figure out how to ask my question. Is that separate and apart from the human resource asset that the mayor is looking at hiring to help deter what happened last week?
Oh, absolutely.
That's different.
Yes.
Okay. And do we have a number for that yet?
I don't think they've gotten that far with talking to those other platforms to get any information as to what was needed to do what they're telling us can be done. So
Okay.
I think that's as best as I could put it. I would say maybe in the next week or two they'll have a price, but
At least a ballpark for when we
yeah.
start talking about it next week.
Yep.
Okay. Thank you.
I think if they say that it can be done right after we hang up the phone, I'm just going to do it and pay it out of my budget. So I'll fight with David later on.
My money's on you.
All set? Any other questions? Seeing that there aren't any for the police department, we will move on to animal control. Page 68.
Animal control is asking for a pterodine also. I'm trying to tell you that.
Chief Pernod, I have two questions regarding animal control. So for line item 52100 gas heating, we have $0 in that budget. What is happening with that? Are we changing it over to a different source? Podium.
We haven't spent money on that since before 23. Because if you look at the
23,
budget, it's
okay.
all zeros all the way across. We just happened to, for some reason, put a budget in there for 24.
Okay, thank you. And for line item 52130, the same thing. We are budgeted at $0. Is there a reason for that?
Which line item was that?
That is 52130, water.
Yeah. Most of the building is, bills get sent right to the city, and it's incorporated into their umbrella, I guess.
Yeah, and again, we haven't spent money on that. We spent $39 in 2023, but we haven't spent $1 since.
Okay,
So.
perfect, thank you. Any questions for Chief Curnow? Councilman Pascal.
Thank you very much. Chief, there's a line item for dog food, but basically, how does the office accept donations? What and how?
They do accept donations. This food line item is for, some of it is for specialty food. If someone, a pet or a dog, cat has an allergy or a skin condition, something along that lines, they'll take it out of there. But yes, they do. Our phone system does not work at the animal shelter either. So that's been a big problem for the last several years.
Okay.
I believe through other means that there's contact any of the animal control officers, or if you go there and somebody's there, they can drop off food. Absolutely.
Right. I've gone by before and seen food and other items outside as a drop off, but I didn't know if there's something you guys needed more than something else.
We're working on trying to get something set up with a vendor in the area that they can go and just pick something up and then get billed for it, so that they don't have to have wait or something. But, yeah.
Perfect. Can you just let the council know when you work that out so that we can spread it to our constituents?
Yeah, absolutely.
Thank you.
You're welcome. Councilwoman Callahan.
Thank you, Chairwoman. Hello, Chief, again. This is in response to Mr. Pasquale's question. I just went Saturday with Councilwoman Muller. I always say Muller. And we had a nice visit at the animal shelter. And a couple of things just to clarify why we have everyone's attention. The two ladies, Lorna and the other young girl, were very, very, it might have been Morgan, I believe. I don't remember. Was it?
Shannon Rose, yes.
Shannon Rose, yes. They were in the middle of cleaning everything, so we couldn't really go in and visit, but we were able to at least go in and have a nice talk with them to see what they needed. But to answer your question, they are looking for pedigree, canned food, clear across the table. So just wanted to, if anybody's watching at home too, that it's pedigree that they found works best for all the dogs at least. And the donations are taking for that. If there's other food, they'll take it and then disperse it where it would be. But also, as Councilwoman Melly Grant always says, that they do the cans too. So we went up and we brought some bags of empty cans. They take the cans, it goes through Vertical Church. Vertical Church was there on site, and that place was full of just empty cans. They take it, they bring it back, they separate it, they take the funds, and then it goes back into whatever's needed at the animal shelter. So I just wanted to follow up with that because I think it's important, and I feel like they're like the forgotten little guys up there. So, and then of course, hopefully with the grant money, that phone system will finally work and you won't have to worry about it because it does go right to the police department. But I hope that that is fixed sooner than later.
Yes, that's going to be addressed with ours, as well as the $300,000 improvements for that.
Yeah, that's what we were told. So I just wanted to follow up with the food, so I think it helps. Thank you.
You're welcome. Councilwoman Tucker.
Longevity pay. What is that?
That's the same as any of the officers. They get a stipend for being with us for X amount of years. They're within the police union, the 4 animal control officers.
Okay, so they're officers. They're police officers.
They're animal control officers, yes, but they have this within the same police union as the other sworn members.
I see. Thank you.
Any other questions? Councilwoman Coletti.
Thank you, Madam Chair. You mentioned telephone expense. I'm not sure if I'm missing it, but I don't see telephone expense here at all.
Correct.
Right. Is it go with your telephone expense for your budget?
It at one time it was on the city's telephone. That's why it doesn't work up at ours because
is that the problem?
No, it's just that it's so we're at College Street and they're here.
Right.
So they can't. It can't. There's no way it can work because they've got the barn right next to the garage, and everything is focused on the garage and the little building that's the animal shelter is just cut off from everything. So that's basically what happened. That's why they don't have phones. We have so that they can call from desk to desk, but they can yell at each other also to get their attention.
So they couldn't just call like
Hopefully when
Verizon
it gets
for like $60 a month and like get a phone installed there, right? That's not how it works.
But they have their cell phones that we call them on when they call in here into the PD.
Okay.
But once the phone system is done at the PD, it'll be incorporated at the animal control shelter, and that'll be on the police department's bill. So there's totally no difference.
Got it. Thank you. Thank you.
Welcome. Chief Perno, for veterinary services, is this a on-call veterinarian, or do you have to actually bring the animals to a facility?
No, they bring the animals to a facility.
Okay, and what veterinary do we usually
Orange
use?
Vet and Orange
Vet, okay.
on Route 1.
Thank you so much. Councilwoman Heffernan, you're welcome.
Chief, we only have 4 officers at this time.
Correct.
Is that a contractual increase, the 23.7%, or are you getting another part-time person?
No, that for the salaries.
Yeah.
That's that was a contractual. Plus, the city absorbed the $10,000 increase from the ARPA funds.
Okay. Thank you very much.
You're welcome. Councilman Vargo.
Thank you, Madam Chair. Chief, just 2 quick questions. What's the driving force to increase the overtime by about 53%?
The increase in their salaries, as well as just the coverage, because now there's 4, so we have the shifts that they have to cover.
And is this department sufficiently funded for what they do, or is there a long list like your department of?
Most of it is being covered by the grant that the mayor got for the city when she was with the state. I don't think that there's anything that is going to be needed after that. I'm sure that they'll be able to incorporate everything structurally they'll need in that. Vehicles we give them from the police department fleet. We take anything that they need out of their budget, and I don't know if there's anything right here that is underfunded at the moment. I don't believe so. But if you want to add some, go right ahead.
Thank you, Chief.
Any other questions for Chief Perno regarding animal control? Councilman Johnstone.
Chief, the part-time wages. So I know in the past we've had a very hard time getting someone to even apply, let alone take it, with the kennel cleaning and maintenance and so forth. If there's been so much trouble and we've barely used any of it in the past, has there been any consideration to maybe possibly slightly increase that ever so slightly, just to entice maybe more interest to help out our 4 officers?
The wage right now is $1 over minimum wage. That's the same as the crossing guards that we employ for the schools. They work the 19 hours a week or so. A lot of it is kids still come here in the summer, then they'll go back to school, and then we're budgeted for about 4. We usually have 2 steady, maybe not the same 2.
Okay, that's all I have. Thank you.
Any other questions? Seeing that there aren't any more questions, thank you so much, Chief Perno, for
Thank you.
answering our many questions and for dressing up for us tonight.
Thank you. Have a good night, all.
Good night. Thank you. Up next, we have ERS, Katie Vicellio.
I have the privilege of giving you the emergency reporting system budget for year 25. I am the acting interim director because our director retired in August last year. So I've been doing the job since she left until the commission found someone to replace her. Accomplishments for the year, we've worked with Frontier and with the 911 with the state. We now have texting capabilities, so if you're in the back seat of your car and you want to text 911, you can. And we can, if you dial 911 on your cell phone and you hang up, we can text you back if you don't answer your phone. So it goes both ways now. We signed a 5-year lease last August to agreement with the Regional Water Authority to keep our radio equipment shed on the property next to the Shingle Hill Water Towers at 40 Shingle Hill Road. We are still in the process of legalities going back and forth with Yale. They want to utilize our shed at Shingle Hill so that they can run fiber from New Haven, from their offices in New Haven to West Campus. Shingle Hill is the highest point, so they would like to use our shed to run fiber from there. And if and when this happens, hopefully they'll get through all the legalese, our radio system would become fully redundant. We'll have a backup to the backup. The increase of our budget, the negotiations with the union went through last October, so whatever was budgeted, they agreed on a 2.75 for last July, and then a 2.5 for this coming July. It's still sitting before the council and MARB, so they haven't gotten those raises yet, but I had to budget for the 2.75 in addition to the 2.5 coming up this coming July. So there's like a double increase in pay. Training costs, just the overtime cost of the department. Training hasn't really become more expensive. Same cost, per course, per trainee. I'm in the just started training 4 new trainees. We hired 4 new dispatchers because we have 4 vacancies. And that's from just like the police department. They trained with us 4 or 5 months worth of training. They worked 3 months and they went somewhere else. They didn't even stay a year, a couple of them. And the director left, so I'm the acting director, so I'm off the board. I'm not answering the phone. So there's that vacancy. When we had a death last year of one of our dispatchers. So 4 vacancies. We hired 4 new people. Hopefully they'll be on by July 1st, and we'll get back to normal. But come July,
I'm so sorry.
it's all right.
You take your time.
47 years, Richie Standish is retiring. And just another one, you know. So I just 38 years I've spent with him. So it's hard to talk about him leaving, and it's going to be a whole new era. We're going to have almost a whole new department. So, but I just get emotional. I'm Irish.
So am I. It's okay.
It's okay. Besides that, we our maintenance agreements, there's no increases expected. Our Motorola is in its 3rd year of $159,000 5-year agreement, so we'll be staying steady with that. And thank you. And our estimated subsidy from the state for our 911 is somewhere between the estimated $169,000 last year. We ended up with they told us $183,000, and so that offsets the budget. So our goals for the future are to work more with the school system to educate people on 911, and we've even gone into the community house and the WIC program, WHINC, to reach out to the Spanish community and get them involved so that they know, what 911 is about and emergencies, and get them educated, as well as the kids in the schools. So, any questions?
Thank you, Katie.
You're
it
welcome.
really means a lot to see employees from the city of West Haven really care that much about each
Oh.
other. That's what we're about. I just had a quick question regarding the chief dispatcher position. Are we getting rid of that position and replacing it with the director?
The chief dispatch. Yeah, you could help me.
Thank you.
We did that in the 24 budget cycle.
Yep.
Yeah, so that was same person. We changed their title.
Okay, that's what I thought. Okay. Thank you so much, Mr. Taylor. Any questions for Katie? Councilman Vargo?
Thanks for coming, Katie.
Well, thank you for having me. I'm good. Thank you.
The since you've been able to fill those 4 vacancies, is that why the overtime and the part-time payroll figures are being reduced?
The temporary payroll was
No, the line 51300 part-time payroll, there was 23,000 budgeted for fiscal year 24, and then nothing for 25.
no. He's yeah.
What's happening there? The part-time, it's all getting charged to regular wages, and
That's what I figured.
yeah,
It's wrapped into
And-
regular
and,
wages.
Yeah, we kind of struggle with that 23, 24, and then when I said, let's stop the nonsense or just let it flow. And as with other departments, we budget at full capacity, and so therefore the overtime reflects a full capacity overtime coverage, vacations, holidays, death in the family.
But it went
sickness.
down.
Yes, it's down. It's back down. It's slightly under the 24 budget, but yeah, it's a little bit less.
Okay. I had the pleasure of on your invitation, my son and I had the pleasure of visiting dispatch. He got to sit in your really cool chairs, and he had a great time. What losing dispatchers, I understand from our talks, is absolutely devastating.
Right.
Because you have folks that are working 16 hours.
I have folks that are working 80 hours a week right now.
And
for weeks on end.
And they're answering the phones. They're dealing with high stress, high emotion. They're part quarterback, part therapist. What do you have any idea what we can do as a city to help your department retain the good folks that are there and to attract? I know that you're fully staffed, or you will be fully staffed, but why are we losing people?
Well, one, to retirement in age, and
That's no excuse for Rich. He sits down.
His daughter wrote a very nice retirement letter for him. He's been with us 47 years. So I'm not going to give you his age, but he started back in 1977. So,
He was 2, yeah.
He started kindergarten. And
Crawled in.
But like the director, she put in her 20 years, and she moved on with her husband, who's a retired fireman from the city, and they moved south. So that was another loss. And one of our dispatchers passed away last year from cancer. So it just one thing after another.
Do you see normally a high turnover, or was that just exceptionally
It's just
poor
been
timing?
It's been exceptional the past few years.
Okay, so it's not like other departments where are we paying somewhat competitively?
Not anymore.
Okay.
When I got hired back in 1986, we were in the top 10% of the state for wages. Now we're probably in like the bottom 30 because we went 6 years without a raise.
So really the reason why we hear that we lose people or can't track people, it applies to you as well. There's nothing different. It's the same old problem. Okay.
Correct.
Okay.
Yeah.
Thank you.
You're welcome.
Councilman Tucker.
Hi. Well, I can't say it's all on the job training anymore because they also go to.
Point of order. I'm so sorry. Mike.
Like,
thank you.
Should I ask the question again?
Yes, please. Thank you.
Okay. Can you explain a little bit about what is required for the person to have in the way of education or training for that job? I don't know if I said it the right way the first time or not.
Okay. It's on the job training, as well as being certified to answer 911 and the state. There's a telecommunicator class that everyone has to go through. When I went through, it was 40 hours. Now it's 24 hours. But because of COVID, they do a lot of remote and online training. We go through emergency medical dispatch training. And those are certifications we have to keep up every 2 years. And as we're also police dispatchers, as well as the call takers for the police and fire, and dispatch the fire departments and order ambulances, through AMR. So we have to stay collect certified, and they just made that every year instead of every 2 years. So every year we go through the training and recertify to keep using the program.
What is collect?
Collect NCIC is the program where we, when an officer does a traffic stop, we run the plate, we run the person, we enter warrants, we enter stolen vehicles, put all that paperwork together for the officers to make their reports, that type of, all that. Wow. Research and instantaneously, almost, because when they're out on the street pulling over a vehicle, they want to know who they've pulled over as soon as you can get the information back to them.
Right.
so that they know who they're dealing with. So there's a lot of certifications now to stay as a dispatcher.
Wonderful. Thank you so much.
You're welcome.
Councilman Coletti?
Thank you, Madam Chair. Hello.
Hi.
2 quick questions. Ironically, your telephone expense seems to be the lowest that we've seen today. Your maintenance service agreement, can you please elaborate a little further on what that line item entails?
The maintenance service agreement.
52510. For 254,000.
That is the battery backups at the tower sites where our antennas are, microwave at Burwell Hill and Pagels and Shingle Hill.
Got it.
Yearly maintenance agreement for our next gen computer-aided dispatch program.
Okay.
The voice recorders, maintenance agreements to keep those up to date. You know, the added software as well as if it stopped recording, I have a maintenance agreement to have them come out and fix it.
Okay. Did I hear you correctly? You mentioned before you've signed a lease and you're renting a facility that you're
We it's for $1.
But I mean, it's a
$1 back and forth.
Okay.
We built a equipment shed on the water company property next to the Shingle Hill Tower. We have access through the Dwyer's driveway, 4042 Shingle Hill Road up at the top.
Okay.
It's all gated, locked.
Okay. I just wanted to make sure the nature of that agreement. I didn't see a rental expense.
Oh
I
yeah,
just wanted to make
yeah. No, there's no expense because it's back and forth. We
Okay.
use their equipment, they use our
I mean,
generator. We
that
share.
makes sense. Okay.
Yeah.
And then I think the last question, 54110, health insurance premiums. Any idea January actual expenses are 0? When the light items,
That
300,000.
it doesn't get costed out until the end of the year when they know what the insurance premiums were for
Okay.
this fiscal year.
We hadn't made the entry yet. It's
Got it.
It's kind of it's an allocation.
Yeah.
Okay.
Yeah.
That's it for me. Thank you so much for what you guys do. Appreciate it. Thank you.
You're welcome. Councilman McMillan.
Thank you, Chairman. Hi, Katie.
Hi.
How are you?
I'm good.
I just had one quick question.
Okay.
The director of ERS, is that a union job?
No, it's a contract between her and the city.
Will you be applying for that job? Now that you're doing it?
There's a commissioner on it. No, I didn't make the cut and they hired somebody else.
Oh, okay.
But
Okay.
they haven't been introduced to the office yet.
Gotcha. Okay.
So, yeah.
Alrighty. Thank you, Katie. Thank you.
You're welcome. Any other questions for Katie? Councilman Johnstone.
No, if we're done with the questions, just please tell your staff on the night of February 25th, I say thank you. Job well done.
Any other questions for Katie? Councilwoman Coletti.
Thank you.
You're
Sorry,
welcome.
just one more quick because the point of mental health has just come up a few times tonight.
Oh, yeah.
Do you have any funding or programming in your budget for kind of ongoing mental health support for your dispatchers?
Everybody gets an EAP card when they get hired.
Can you elaborate on what that is?
Educate Employee Assistance Program.
Okay, right, okay. So it's elective but not mandatory?
It's elective, yeah.
Okay. Okay, thank you. Thank
You're
you.
welcome. Any other questions for Katie? Seeing that there aren't any more questions, thank you so much, Katie, for answering the questions that we had. And we are going to, thank you. We are going to recess until tomorrow at 6 p.m.